Ladies and gentlemen, we're just waiting for some technical difficulties to be resolved before we start the meeting. Thank you for your patience. Good evening, ladies and gentlemen. Welcome to the Ottawa Public Board of Health meeting for this evening. I want to welcome everybody. I want to thank everybody for joining us this evening. And we do have a fairly lengthy agenda, so just ask for your indulgence in terms of if the meeting goes beyond 7 o'clock this evening. And we'll ask the public and the board to extend that meeting request with a motion this evening later on. Having said that, I know we're starting a few minutes late, but as I said earlier, it's due to technical difficulty that unfortunately we're unable to resolve, but it's just going to affect probably one delegation's presentation, and we'll let you know that when that comes about. So having said all that, there are no ceremonial activities for this evening, so carry on with the agenda. I'll ask the secretary to do the roll call, please. Thank you.
Member Chernyshenko?
Présent.
Member Fleury? Ici. Member Kapoor?
Present.
Member Lakin?
Present.
Member McKenney?
Present.
Member Pinel?
Présent.
Vice-Présidente Poirier? Member Chair Kadri?
Present.
Member Kakish?
Present.
Member Taylor?
Here.
Member Tilley?
Present.
You have quorum, Mr. Chair.
Thank you very much. And Vice Chair Poirier has sent her regrets, so unfortunately she's not going to be here this evening. Any declaration of pecuniary interest, including from previous meetings? Seeing none, thank you. Confirmation of minutes from February 13th. Can we ask the board to approve those minutes? Carried. Thank you. Communications, we received 11 communication items that have been received and held on the Board of Health file. With the Secretary, motion to introduce reports. Member Pinel.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, Ottawa Public Health 2016 Annual Report, Healthy Eating, Active Living, Protecting Vulnerable Populations Through Restrictions in Marketing of Foods and Beverages Report, Quality Improvement Plan for 2017-2020 Report, Ottawa Public Health Emergency Preparedness and Response Report, and Delegation of Authority Contracts awarded for the period of July 1st to December 31st, 2016, report be received and considered. Il est résolu que les rapports et contrats énumérés soient reçus et examinés. And be it further resolved that the rules of procedure be suspended to consider the following additional item due to the timelines associated with same. Report from the Medical Officer of Health titled Update on Opioids and the Risk of Unintentional Overdoses in Ottawa.
Is that carried? Thank you. Going on to consent agenda, and again, we'll go as we normally do, item by item. So the first item is Chair of the Board of Health verbal report. We will hold that report, as I do have a verbal report, along with item number 2, that the Board of Health for the City of Ottawa receive the report from a verbal report from a Medical Officer of Health, and we will hold that item also. Item number 3, Ottawa Public Health 2016 Annual Report. We'll hold that item also because we have a presentation on that, and it's the report that's in front of you, the color document. Item number 5 is that the Board of Health for the City of Ottawa unit receive this report information, which is the Quality Improvement Plan for 2017 and 2020. Is that received? Thank you. Item number 4, which is the healthy eating, active living, protecting vulnerable populations through restrictions in marketing of foods and beverages. We will hold that report as there is a presentation. Item number 6, Ottawa Public Health Emergency Preparedness and Response. Can we receive that report? Or are there questions? No. Received? Thank you. Item number 7, Delegation of Authority, contracts awarded for the period of July 1st to December 31st, 2016. Can we receive that report? Thank you. And the additional item that Madame Pennell introduced that we will add to the end of the agenda, which is the report on opioid that's coming up on the table. So we'll hold that item for discussion and presentation. Okay, moving back to item number 1, which is my report. Once again, good evening, everyone, and thank you for again joining us. Tonight, I would like to begin by sincerely thanking all Ottawa Public Health employees, particularly those involved in the response to the opioid issue in our community. The world of public health is unpredictable, and it often requires that OPH take action, reacting to alarming and serious events. The employees of Ottawa Public Health have managed this emerging crisis by strengthening community partnerships and broadening our strategy of prevention, education, and harm reduction. Ottawa Public Health's ultimate aim is to eliminate overdoses and death due to opioid misuse. I thank each and every one of you, our residents, our community partners, for the role you have played in addressing this significant community issue. I wish now to update the board on 2 recent events. The first is Ottawa Public Health's involvement in Crime Prevention Ottawa's Forum on Family Violence. According to Statistics Canada, more than 320,000 people were victims of violent crime in 2014, with 26% having been victimized by a family member. Family violence takes various forms and impacts young and old. While at this forum, Ottawa Public Health was able to showcase our health unit's effort in working with families. Dr. Levy moderated the forum panel, encouraging a fundamental discussion on family violence, as well as highlighting our work as part of our Healthy Babies, Healthy Children program and our participation in the Ottawa Elder Abuse Response Committee. We look forward to continuing to work with Crime Prevention Ottawa and other partner organizations to reduce the incidences of family violence. Second, I would like to provide an update on the most recent all-staff event, which took place March 21st. This year's all-staff meeting was indeed a memorable one. Those in attendance were encouraged to reflect on change and embrace equity. What an opportunity it was to learn, particularly from 3 Indigenous elders who challenged us about our own assumptions and beliefs. We had significant conversations regarding Indigenous health and learned a great deal about Indigenous culture. We were joined by Deputy Minister of Ontario, Ministry of Indigenous Relations and Reconciliation, Deborah Richardson, our keynote speaker for the meeting. Several board members, including Member Pennell, Tilley, and Councillor Fleury, Kakish, Taylor, and Chernyshenko, were all able to join us. It was a very special meeting, and I think an excellent educational opportunities for all employees who were able to attend in person or via live stream. As we look to the future, I trust that we will continue to learn from those shared experiences and focus on actions that promote reconciliation. Thank you, and with that, I conclude my verbal report for this evening. Any questions or comments? If not, can we receive that report? Thank you. Now over to Dr. Levy for his verbal comments and report.
Merci beaucoup, Chair. Thank you, and good evening, everybody. Before I start, somewhere in the darkness over there is Chris Brecker, who has, Chris is waving right at the back. I just want to mention, Chris won't be known to some of you, but he has been the force behind bringing us and our meetings to the broader community through the live stream initiative. Chris is moving to new opportunities within the city, and so we'll be missing him, but I want to take this opportunity, Chair, to thank Chris for everything he's done for us until now. And I dare say, I hope we don't go dark now that Chris is moving. Thank you also for agreeing to a walk-on report. We have not had walk-on reports previously at the board, and we do strive to be sure that you have good and adequate time to reflect on the material that we're bringing to you. But there are reasons that we wanted to have this discussion with you, and we needed to do it in a timely way. So Mr. Hendricks and Dr. Etches will certainly be outlining developments on the opioid overdose prevention task force and issues around that, and recommendations for your advocacy relating to federal legislation later this evening. So my thanks to you, and thanks to the chair for agreeing to entertain that. I want to restrict my comments then tonight mostly to some of the things that went on at the recent Ontario Public Health Convention. This is a convention that was held last week. I was there. You'll know, of course, that the event is an annual event sponsored by Public Health Ontario, by Alpha, and by the Ontario Public Health Association, and it really is the preeminent scientific meeting relating to public health practice in Ontario. There were just under 900 participants from across the province, so very well attended, and a lot of cutting-edge material discussed there. I'm proud to say that we were well represented. Ottawa Public Health had several of our staff sharing the innovations that we carry out here in Ottawa. We had many presentations. One of the highlights for me was Dr. Pim, who was a plenary speaker and shared with participants the extraordinary contributions of our volunteers and staff to the refugee program last year. And of course, she's doing that through a scientific lens, which was very well received. Also, I moderated a session relating to the evaluation of emergency preparedness initiatives, and that session dealt with outbreak prevention, focusing discussions on Zika, Ebola, and other infectious disease threats. So it gives you a bit of a taste of the kinds of things that are of interest across the province and how we fit into that. And needless to say, as you will have seen, certainly in the press, I'm sure, and some of you will know from other work, that while that convention was going on, our own routine work here in Ottawa was very much going on with the teams dealing with flu and gastrointestinal outbreaks, possible measles and mumps exposures in the community, and of course, as recently as today, some issues around water quality and the need to be on top of issuing drinking water advisories when the need arises. So operations continue while all this is going on. But the main thing that I want to flag for you tonight is that the Ontario Public Health Convention is also an opportunity for the ministry to provide updates on its priorities and work. And we heard presentations from the Deputy Minister of Health, the Assistant Deputy Minister for Population and Public Health, and the Provincial Chief Medical Officer of Health. And all spoke about health system transformation and the view of the ministry relating to the role of public health in that transformation. So this is an issue we've discussed around the table previously, but I thought that given the timing of the initiatives and how things are evolving at the provincial level, I thought it interesting to reflect on the content of those presentations last week. Essentially, they focused on three things that I think we have to keep in mind. Firstly, the future role of public health in Ontario, and that really takes form in what the ministry will be asking boards of health to do in the future through the Ontario Public Health Standards. Secondly, the issue of the role of public health in health system transformation in the future, and that really takes form in the question of how medical officers of health and boards of health will be relating to local health integration networks in the future. And thirdly, lastly, the question of how public health will be structured and governed in the future. So with respect to the first issue, what will be required to do, what our role in public health will be in the province in the future, of course, you're aware that the ministry recently released a draft of proposed new public health standards. We're currently in the midst of a period of consultations regarding the content of those standards. And the expectation is that the new standards will come into force and effect at the beginning of January of 2018. It seems that there would be a period of transition that will allow for adaptation and adoption of the standards over a longer period of time. And that's really in recognition, softly, of the fact that organizations like ours will need to facilitate an alignment with existing budgetary and operational planning cycles that may take at least a year, perhaps 2 years. So the consultation period ends on April the 21st, and we've done a preliminary review of the draft standards. I think that review suggests that implementing them may well require substantial reorientation of resources and structural and functional changes in the organization if the standards stay in the form that they are, which I would expect they will. So we've initiated a process to ensure that every member of staff at Ottawa Public Health has an opportunity to reflect on the implications of those proposed standards from their point of view, implications for their work, implications for the community, and implications for themselves. And that each individual member of OPH, the OPH team, participates also in team meetings that will better inform or will inform both responses to the ministry consultation and also the future operational planning and organizational needs. Of course, we welcome your thoughts in this regard, and you'll recall also that the ministry was here in Ottawa last month where we essentially hosted a consultation session for Eastern Region on behalf of the ministry. Staff and board members from OPH and from neighboring health units had dialogue with the ministry at that session. So we will be submitting written input prior to the consultation deadline. We'll certainly circulate that to each of you in advance for your information. And of course, if any of you has any comment or input, we'd be more than happy to incorporate that. With respect to the second point, that's the point of the future relationship of boards of health and medical officers of health with local health integration networks. What I'd refer you to is the material we discussed towards the end of last year. We talked a little bit about it even at our retreat in the fall last year, and that's the ministry working groups and work streams. There is a ministry work stream focusing on public health and the implementation of Patients First legislation. That's one of 17 work streams that the ministry has to try and move forward on the transformation agenda. And we understand that that work stream will be making recommendations to the ministry in May of this year. And then regarding the third point, the future structure and governance issue, you'll also recall the recent memo from the minister announcing the expert panel on public health. That panel has now started its work, and it's the subject of a communication item in the package this evening as well. And we understand that it's on track to report in the spring. So a little dry, but I think really important for me to bring this to your attention. There's a lot of work going on at the ministry. It has the potential for significant impact on our operations, partnerships, and accountabilities in the future. And of course, as this unfolds over the months and years to come, we'll be updating you on the issues as we move forward. So that really was what I wanted to use my time with you tonight. But just before I end, I also want to advise you, for those of you that may not have had an opportunity to crack your emails this afternoon, that last Friday, the City of Ottawa's Legal Services Group was informed of the legal challenge or a legal challenge to the city's water pipe bylaw. That bylaw, of course, was a product of the work of this board, or at least was in part informed by the work of this board. So I thought you'd have a special interest in it. As I understand it, the challenge is on the grounds that the bylaw violates the Charter of Rights and Freedoms, as it allegedly is discriminatory against the cultural rights of a specific group of Canadians. So, of course, as the issue unfolds, we'll be ready to help the city's legal services group and bylaw and regulatory services branch in whatever way we can. And I'm pleased to say that it's my understanding that the intention will be to vigorously defend against that challenge. You'll remember, I think we discussed when we talked about the issue at the board, that similar water pipe bylaws from Toronto and Vancouver have previously withstood judicial scrutiny, though one of those judgments is currently subject to an appeal. So this is currently a live issue in front of the courts. Shortly, Mr. Chair, I'll make some comments about the annual report for 2016, but with respect to my verbal update, that concludes my remarks, and I'd be happy to answer any questions. Merci.
Thank you very much, Doctor. Any question? Councillor Fleury?
Thank you, Mr. Chair, and thank you for the opportunity to ask questions. I certainly appreciate the format that you provide a wide range of updates. As you might imagine, I'm interested in hookahs, and I want to know the process by which, as of April 3rd, we were to enforce and fine locations that were offering those services. I believe that we followed appropriate consultation, appropriate debate. It came to council following public health board approval. So without jeopardizing our legal approach to this, I'd like to understand what is the timeline and measures that are contemplated for enforcing. So not the legal battle, but as of today, we can enforce. What's stopping us at this point?
Through you, Chair. Thank you. So, from my point of view, I expect that we are enforcing. I don't think anything is stopping us. That would, of course, be the desire, I think, of this board. I have not had a chance today to connect with anyone from bylaw with respect to knowing exactly what their plans are, but I will ask our legal counsel to advise as to whether or not there's any perspective from the city's legal department.
So for greater clarity, the City of Ottawa's bylaw that prohibits the use of water pipes or hookahs in enclosed public places, enclosed workplaces, and outdoor patios, that bylaw has actually been enforced since December 1st, 2016. When that bylaw was approved, it was Council's direction that there be a phased-in enforcement and that charges would not begin to be laid until today, April 3rd, 2017. So this challenge to the bylaw does not change those timeframes. So currently, bylaw and regulatory services will accept any complaints under the bylaw and is following council's direction. That being said, legal services will be responding to this application to quash the bylaw, and it's not unusual for applicants to demand at the court that there be a stay put on enforcement of the bylaw. If that request is made of the court, legal services will review that request and respond accordingly. So other than that, the matter is currently before the courts, and there'll be future updates on that matter.
Thank you. I have a different question, so I don't know if members of the board have a other question.
Okay, go ahead, Dr. Cooper.
Thank you, Chair, and thank you, Councillor Fleury, for allowing me to follow up here. Chair, I just want to make sure I understand it clearly. So what I'm hearing is that bylaw enforcement will still investigate complaints and lay charges, but depending on what occurs in the courts, those charges may end up being the charges will be laid, but if there's any court action, it may be delayed until this application is heard. Is that a correct interpretation of what I heard?
That's my interpretation, but we'll let legal respond to it, please.
Yes, that's correct. If charges were laid, they may be stayed. Also, what may happen is the applicant may make a request that all enforcement under the bylaw cease. But again, that is to be determined. It's early stages at this legal proceeding, and so if anything changes in respect of enforcement, the city will be advised accordingly, and the board will learn of those changes.
Anyone else on the same topic? Any questions? No? Okay, Councillor Fleury, your second point.
My second question is around the marijuana dispensary / federal review. We've seen in the papers the federal review that some of the timelines. I think April 10th is the initial presentation of the bill. I just want to know, in terms of Ottawa Public Health, what is our expectation of the next steps in terms of consultation? And further to that, we've also learned through the media that there's 12 provincial partners that have formed a group and a task force to review what that would mean provincially once the federal authorities would be provided. And I wonder if public health is at the table there.
Thank you very much, Mr. Chair. So we have not had any official communication from anyone at the ministry with respect to plans at the ministry. We are a member of a public health network which is closely monitoring developments and intends to weigh in once the provincial and, well, certainly the federal and then the provincial actions or proposed actions become clear. I'm not aware of the group of 12 that you're referring to. I'll just look past your left shoulder. No, our teams are not involved with that particular group, but we are involved with the group of local public health units that originally submitted a joint submission and worked on that submission together to the consultation process.
Okay, thank you for that. I didn't, just to be clear, I didn't expect us to be part of the 12 because I think those are all provincial departments. But certainly, I want to find a way for us to inform and to be connected to partners in those 12 agencies who are having the conversation around what that will mean for Ontarians. Because, you know, we have a very particular model with the LCBO, with the beer store models in Ontario. Certainly, you know, I'd love for the board to have that conversation on the best approach. I know that we've submitted the documents, so a lot of the content is in place, but I'd like to find a way so that we can stake our ground in one of those 12 bodies.
Well, we can certainly take that away as direction and look into what that particular opportunity may look like. Certainly, we would expect that the provincial Ministry of Health, at least, would inform us as we go forward, and we'd have an opportunity there. The other next step, further to the discussion we had in the fall, is that it is on the agenda that we would be coming back to this board after the federal proposals are tabled with an update with respect to our assessment of what's on the table from them and what the implications are. So I think this board will certainly have an opportunity formally to be apprised of what's evolving over the next several months, and we'll be looking for opportunities to weigh in appropriately.
Thank you. My final piece is just, once the federal bodies are in place, it'd be nice to get Health Canada or whomever to come and present. I'd love for them to hear our local interest firsthand.
We can explore that. Thank you.
Thank you very much, Member Fleury. Anybody else? Any other comments or question on Israel's report? Seeing none, can we receive the report? Thank you. Back again to Dr. Levy about the annual report for 2016 from the Ottawa Public Health.
Thank you very much. I won't take a lot of your time. I know we have substantive items on the agenda, though this, of course, is, from my point of view, a roll-up of the substantive work that we do. And I did want to share with you my pleasure in asking you to receive the annual report before you tonight. The report certainly is an opportunity for us to take pride collectively in the work we do and the impact we have in the community. And in this report, we tip our collective hats to those that have come before us in the proud history of this organization's service to the community. The first Board of Health, as you will have seen in the report, was established 185 years ago, before the city, before the country, in this community. And since then, in various forms and ways, Ottawa Public Health has provided public health programs and services to individuals and communities while advocating for public policies that make Ottawa and its residents healthier. Protecting and promoting health and preventing disease, of course, is embedded in everything we do. And acknowledging our history, I thought, was fitting given our 150th year celebrations. I always struggled to say sesquicentennial, so I tried to avoid it, but there you go, I couldn't help myself. These images are just two of a wealth of images that it can be fun to go through some of the photographs. They remind us of our roles in the community and how well worn some of those roles are. And at least one of them shows that the ability of a public health nurse to make children smile, even when they are scared, is a long-standing tradition. I'll let you guess which one. The photograph, the one on the right, was taken in 1947, and we won't talk about the one on the left, but you can, it gives you a sense of the tradition and the work that we do. Today, of course, the department is vibrant and active across a broad array of programs and services, much broader than 185 years ago when we were really talking about response to infectious diseases only. We're more proactive and obviously function across a much wider range. These are excerpts from those service touchpoints in the community which are referenced on page 13 of the paper copy of the report that's in front of you. Of course, even those are just examples, but you can take almost any one of them, and there's a real story behind every single one of those statistics in terms of touching individuals' lives and impacting and affecting the community, sometimes lifelong changes. The ones we hear celebrated most often, but most quietly, are the touch points in our baby or our neonatal postpartum visiting services, where the nurses are particularly working with particularly high risk and vulnerable young mothers. And so that's one that I frequently celebrate, and the statistics certainly don't do justice to the difficulty of the work or the impact of the work. But the report before you then, if it was going to be brief, needed to select just a couple of highlights. In keeping with the format requested by City Council, we certainly include details of our mission, mandate, and strategic directions, as well as our funding levels and the sources of our revenues. But the sense of accomplishment comes, I think, from the services we provide and the attendant impacts felt in the community. And of course, one highlight in 2016 was the way our teams addressed the needs of the unanticipated influx of several hundred Syrian refugees in Ottawa. We've talked about that before and celebrated it before, but we certainly wanted to highlight it in this report. We also named just a few initiatives in the report. Of course, we built on our existing work with the Wabano Centre for Aboriginal Health, specifically by opening a dental clinic at Wabano to enhance dental services to the Indigenous community. We launched a mental health caregiver guide. We promoted sexually transmitted illness testing through our on-campus Get Tested P challenge. I was negative. I just want to make that point. We encouraged healthy eating and active living, and that's the closest you're going to get to personal health information ever. But we did encourage healthy eating and active living as part of the strategy, and we're going to hear more about that tonight as well. So we did all of these things and of course more as we had our first full accreditation survey. And accreditation was the logical next step on the continuous quality improvement journey that underpins all of our work. The formal development of quality improvement plans, which we now do routinely, is also a part of that. The report comments on that. You've just received a report for our 2016 through 20 17 through 20 quality improvement plan. It is something we're proud of. It's not something that is visible in the community, but it certainly underpins, is an expression, I think, of the pursuit of excellence in everything we do as we strive to serve the community. And I thank you for accepting the plan that was on the agenda earlier. So looking to the future, we'll, of course, continue our work on all of the strategic initiatives that you've identified, and in all of the routine work that we do. We'll continue to strive for excellence in the full spectrum of programs and services. But I do want to just end with an expression of gratitude. Our employees, of course, make all of this happen. You, our governors, and our partners in the community and the community itself, as well as obviously the funders, are what makes us able to do this work. We can't do what we do alone. And so I ask that you receive this report for information with the same sense of pride that we at the staff level have in presenting it. Of course, I'll take any questions about anything I've said or anything in the report itself, or indeed on any of our services. Thank you.
Thank you very much, Dr. Levy. And I just want to add the support from our board members in terms of the support for staff as to how well the staff have done in 2016 and previous years also, but especially 2016. It's been a challenging year, and looking at the start of 2017 looks like it's even going to be more of a challenging year. So it's always great to have good leadership and good support from staff that do come every day to do their job and do their work as efficiently as possible. But having said all of that, I think our staff performs on many tasks very professionally. So thank you. Any questions to Dr. Levy? No? Thank you very much. Could we receive this report? Thank you. Okay, moving on to item number 4 in the healthy eating, active living, protecting vulnerable population through restrictions in marketing of foods and beverages. And before we go on to the presentation and the report, I just want to acknowledge the presence of my colleague, Councillor Keith Eglai, who's very interested in this report along with the other health board items. So welcome, Councillor Eglai. Okay, having said that, I want to turn the floor over to Gillian Conley, our Manager for Health Promotion Disease Prevention Branch. She'll present the PowerPoint presentation this evening. Thank you, Gillian, and welcome.
Thank you very much, Chair. So thank you for having me here today. This evening I'll be presenting additional details regarding our Healthy Eating, Active Living report that's before you this evening. This report was drafted in response to the Board of Health motion that was passed at February's meeting. More specifically, this report outlines a number of policy options for restricting marketing for children and youth at the municipal level, as well as a community and stakeholder engagement plan. This report aligns with OPH's strategic direction to inspire and support healthy eating and active living in our community. Ottawa Public Health has been working on this in various capacities for a number of years. As such, this report before you outlines just one component of a broader strategy to help Ottawa residents live healthier lives. Over the past few years, various national and international agencies and governments have put forth reports and with recommendations on approaches to addressing obesity and overweight in our communities. Each of these reports that are outlined above include recommendations for a whole of government approach, including increasing supports for parents. More specifically, each of these reports include recommendations to restrict marketing to children and youth. Most recently, Heart and Stroke report outlines recommendations that all levels of government could take to address marketing to children and youth. The slide before you illustrates the various opportunities in a children's life where marketing can influence them. Marketing does not just include television advertisements in our modern society. It includes advergaming, guerrilla marketing, product placement, sponsorship of sporting events, use of characters and athletes popular with children and youth, and brand mascots. As you'll see, kids playing on the computer and watching television, Canadian children and youth spend almost 8 hours a day in front of screens. The average child watches 2 hours of television and sees 4 to 5 food and beverage ads per hour. As much as 90% of food and beverage marketed on television are high in salt, fat, or calories. As such, evidence shows that the marketing influences children's food preferences, purchase requests, and consumption patterns. So the advertisements that they see in the television and internet influences them at the fast food restaurants, school, and grocery stores. Although parents seek to purchase healthy foods, the Healthy Kids panel heard that parents know about the importance of good nutrition, but they often feel undermined by the food environment around them. And the recent Heart and Stroke report highlights a parent survey which found 77% of parents said it was hard to monitor and control the advertising that is directed at children. 71% believe that because food and beverage industry spends so much money on advertising to children, it is unfair advantage over parents when it comes to influencing children's eating and drinking habits. As such, building on the recommendations from national and international health agencies and various governments, and in response to research that demonstrates the negative health impacts of marketing to children and youth, the Stop Marketing to Kids Coalition, which includes nationally recognized health opinion leaders, health professionals, and researchers from across Canada, developed a consensus position meant to guide marketing to kids policymaking in Canada. The Coalition's policy recommendation states that the commercial marketing of all foods and beverage to children and youth under age 16 and younger should be restricted. The Coalition also recommended that any policies should incorporate what they've called the Ottawa Principles. These are a set of principles that are outlined above that include, among other things, that these policies should be statutory in nature, use a wide definition of marketing, restrict the commercial marketing to children in child-focused settings, they be enacted through a multi-government approach, ensure that government is a key stakeholder in developing the policies, and ensure that the government sets clear policy definitions. Building on these principles, the report before you outlines policy options for restricting marketing to children and youth at the municipal level. These policy options were identified based on the recommendations put forth by the Heart and Stroke Foundation. This report aligns with OPH's work to make it easier to eat healthy foods. As you're aware, education alone is not enough. Our education approaches, such as the sugar shocker display that was outside, can be enhanced with policies that help create healthy food environments. As such, the report before you builds on this work as just one component and outlines the 5 policy recommendations, which include restricting food and beverage marketing to children on municipal properties and in schools, limit unhealthy food and beverages on municipal property, review zoning restrictions close to child-focused settings, and limiting sole source contracts with food and beverages companies. As such, OPH is seeking to start a conversation about these policy options through a consultation plan. This consultation seeks to provide an opportunity for input from residents, Ottawa, City of Ottawa departments, and other interested parties on the potential for reducing marketing to children and youth through municipal actions. Consultation will begin in April and end in June, and will include an online survey, randomized telephone survey, focus groups, and key interviews with stakeholder and community groups. And so I'd like to thank you for your time, and should the report be passed, we will bring forward a report which will be informed by our stakeholder and community consultation.
Thank you very much, Jillian. And just to lay out the evening as we move forward, what I'll do is, with the indulgence of the board, I'd like to hang on to questions from the board members to staff until we've had the 10 speakers come and present, and then come back to questions with staff after that, if that's okay. That's the route we'll follow. To the members that are coming to present to the board, you each have 5 minutes to present to the board, and I will let you know when you have about 30 seconds left to wrap up your presentation. So the first speaker for this evening is Seema Nagpal from Diabetes Canada. Well, welcome, Seema, and just press the white button in front of you on the microphone, and you're ready to go then.
Is that right? There you go. So thank you for the opportunity to speak with you today. My name is Seema Nagpal. I am here in my capacity as Senior Leader for Public Policy at Diabetes Canada. I'm an epidemiologist. I have a PhD in population health, and I'm a pharmacist, a mother of 2 young children. Sometimes when we think of social policy issues or health issues, these perspectives collide. Sometimes when I think about issues and fully consider the problems and the breadth of solutions, it's not easy to reconcile all those perspectives. But when it comes to the health of our children, the impact of marketing to children, the evidence-based policy solutions, and the moral imperative to act on these data, it all brings me to the same space. We need to stop marketing to kids. So I'd like to talk to you today about how far this has gone. Marketing to kids is no longer about characters on Saturday morning and during Saturday morning cartoons. While TV commercials certainly are a major platform for ads, it's only one of the many ways that children are bombarded with food and beverage marketing. It's morning, noon, and night. It's 7 days a week, 24 hours a day. It's where children eat, learn, live, and play. And we know that the taste preferences and eating habits of children become the dietary habits of adults. A few numbers. In 2014, 26% of Ottawa students grades 7 to 12 reported drinking one sugar-sweetened beverage in the past week. 33% reported that they had drunk 2 to 4 beverages. 9% reported 5 to 6 sugar-sweetened beverages in the last week. And when you talk about the broader category of sugary drinks, we know that young people in Canada consume the most of all age groups. Youth, on average, drink over a half a liter of sugary drinks each day, and that can contain up to 16 teaspoons or 64 grams of sugar. We know that the rate of children who are overweight and obese is at 30% in this country, and that's 1 in 3 children. Perhaps one of the most sobering statements that I've heard is from the former Surgeon General in the US, and he said, and I quote, "Because of the increasing rates of obesity, unhealthy eating habits, and physical inactivity, we may see the first generation that will be less healthy and have a shorter life expectancy than their parents." According to our own Government of Canada statistics, over the past 30 years, obesity rates in children and youth have tripled. And these higher rates of obesity, coupled with the less active lifestyles, have contributed to a diagnosis of type 2 diabetes in children. This is a disease that was only previously associated with adulthood. Anecdotally, one of our pediatric endocrinologists recently said that in his practice, about 10% of kids are living with type 2 diabetes. And these children with type 2 diabetes also have high blood pressure and high cholesterol. They are on an unhealthy trajectory for the future. Overweight and obese children are likely to become overweight and obese adults. They are at high risk for complications like kidney failure, heart disease, and stroke. And in fact, they face a far bleaker outlook than adults living with the disease because they're living with it for longer. So what do we do for this complex social problem? Well, we don't find ourselves in this mess for one single solution, for one single reason. And so I can assure you there's not one single solution. And indeed, we've never said there was one magic solution. Marketing is preventing too many children from developing healthy eating habits that would extend into adulthood. It's not the only obstacle, but it is a significant one. A successful approach will require interventions at the individual level, like education and food skills, at the community level, like the ones that are proposed in the report before you. It will also require provincial and national level legislation to support a healthy food environment. A good example already exists in the tobacco control strategies. Smoking rates in Canada have been cut by half, thanks to a comprehensive strategy which included restrictions on how these products could be marketed and sold. So it will take a concerted effort, just like it did for tobacco reduction. This will require elected officials at all levels of government to act on the behalf of children, because our children, they're not all right. Thank you.
Thank you very much, Ms. Nagpal. Any questions or comments to the public delegation? No, seeing none. Thanks again for coming out, and thanks for presenting. Our next speaker is Monique Potvin-Kent from the University of Ottawa Faculty of Medicine. Good evening, Ms. Kent, and welcome, and thank you for coming this evening. You have 5 minutes to present to the board. Thank you.
Thank you. That's the right button. Perfect. So first of all, I wanted to talk to you about the health impact of food and beverage marketing to kids. I've been doing research on food and beverage marketing for the last 10 years at the University of Ottawa. The most important thing to know is that it is having a huge impact on children's health. First of all, in the mid-2000s, there were 2 big systematic reviews of all of the literature that were done, one by the Institute of Medicine and the other done in Scotland, and they both came up with exactly the same conclusions. Food and beverage marketing to kids has an impact on kids' food preferences. Kids prefer to eat foods that they've seen marketed. It has an impact on their short-term consumption patterns, so they actually choose to eat foods that they've seen advertised. It also has an impact on the foods that they ask their parents to purchase. And finally, and probably most importantly, it has a big impact on childhood obesity. Now, in Canada, the way that food and beverage marketing is regulated, it's self-regulated by industry through the Children's Food and Beverage Advertising Initiative, which began in 2007. Now, this initiative is not protecting children's health whatsoever. First of all, there are many exceptions to what they include as advertising to children. They don't include fundraising and reward programs in schools. They don't include sponsorship. They don't include settings where children gather, such as recreation centers. Only 18 companies participate in this initiative, so in some research that I've done, there are over 35 other companies that do market to children regularly. There are no limitations about spokes character use. Those are characters like Tony the Tiger and Snap, Crackle, Pop. The frequency of marketing isn't limited at all, and their definition of healthier foods that can be advertised to children is very, very weak. Now, in terms of the actual exposure to kids, so I've done research on television which shows that on kids' stations, children are seeing about 4.7 food and beverage ads per hour per station. For teens, it's even a little bit higher, 5.2. Now, when we look at the actual food categories that are being advertised to children. The most frequently advertised product categories to kids are restaurants. Fast food restaurants is the #1 category, followed by candy and chocolate bars and cakes, cookies, and ice cream. And when we do nutritional analyses of these categories, we find out that 90% of these foods are either high in fat, sugar, or salt. 90% are unhealthy. I've also done research where I've compared what was going on before self-regulation and then after self-regulation. Are we actually seeing an improvement? And actually what we found out is that kids' exposure to food and beverage marketing has increased by 17% since self-regulation was implemented. So things are worse now that we have self-regulation. Other places where things are worse, there's more spokes characters being used in advertising. Licensed character use has also increased. That's using characters like Dora the Explorer and Spider-Man to sell products to kids. The healthfulness of products has not changed at all since the initiation of self-regulation. I just finished a study on digital food and beverage advertising with the Heart and Stroke Foundation. We looked at kids' top 10 websites, top 10 online websites with advertising. We found 54 million food and beverage ads. More than 94%, or about 94% of those ads were either high in fat, sugar, or salt. And the products that we saw advertised the most frequently, Kellogg's Pop-Tarts, Frosted Flakes, the Happy Meal, Red Bull energy drink, and Kraft Lunchables. So not products that we want our children to be eating. In terms of what's going on in Quebec they have a law called the Consumer Protection Act. It's existed since 1978, and it basically bans all advertising to children under the age of 13, and it applies to many different forms of media. Now, we have seen some differences with what's going on in Quebec. I've done comparisons looking at what's going on in Ontario versus what's going on in Quebec, and kids in Quebec are seeing less food advertising on television than in the rest of the country, about 23% less. And the food categories they see are also very, very different. They're not seeing the sugary cereals. They're not seeing the portable snacks like Fruit by the Foot and Dunkaroos and all those junky cereals that are sold to kids in the rest of the country. And they don't see the candy ads either. So the Quebec the Consumer Protection Act is having an impact. In summary, we know that marketing to kids is having a significant impact on children's health. We know that self-regulation is not working. So as a result, I'd really recommend that the Board of Health allow Ottawa Public Health to consult with the public, and also I'd encourage the city to support the federal bills on this matter at the time. Thank you very much.
Thank you very much, Ms. Kent. Any questions? Councillor Taylor?
Thanks very much, Mr. Chair, and thank you very much, Ms. Kent, for your presentation. It's clear from your research anyway that self-regulation isn't working. We put the fox in charge of the chickens. I'm interested in your research where you looked at Quebec and their advertising ban.
Yep.
You know, we're kind of taking the perspective here about consulting about marketing to children.
Yes.
And I'm interested, the Quebec ban, if I understand it, is about advertising.
That's correct.
Not necessarily marketing. So,
that's right.
You know, if we look at things like the presence of, do children in Quebec still see the presence of, you know, unhealthy vending machines front and center in arenas, those types of things, or do they include that?
No, that would be included as well. So if it is child targeted, so in Quebec, the law really specifies that things have to be child targeted. So if that vending machine was designed to appeal to a child, it would be, you know, there's a group in the government who would look at that to see is it child targeted. But there's no monitoring of the Quebec law, unfortunately. So that's kind of one of the areas where they need to do some improving, but certainly that is included. If anything that is targeted at children cannot. There are a few exceptions, but the exceptions look at things like magazines and labeling, because that's under federal jurisdiction.
So I'm sure you must have done some kind of a critique of the Quebec model.
Absolutely.
You know, I think we'd probably love to have that if the board passes the consultation tonight. We'd love
certainly.
To
that can definitely be passed along, yes.
Okay, thank you.
Thank you.
Mr. Chair.
Thank you, Member Taylor. Member Kakish?
Thank you, Chair, and it was just on the Quebec thing as well, because you kind of ran through the slide quickly because of the time, I think, but on what were the numbers that you had? So when did that law come into effect in Quebec, and has there been information or enough data support that? Was that what that graphic
Sure.
showed?
So the law came into effect in 1980. And so I've done there was some research done in the early 80s looking at things like, do kids in Quebec, for instance, because the law is not just applied to food, it's all advertising to children, so it applies to toys and everything. So there was research looking at the impact, do kids in Quebec actually recognize toy products the same way that kids outside of Quebec do, and that type of thing. And it always showed that kids, for instance, in Ontario recognize those brands more than kids living in Quebec. There was also some research done in about 2010 by Baylis and Dar that looked at fast food consumption, and what they found is that in families with children, that there was less fast food consumption as a result of the Consumer Protection Act. So they do believe it is having an impact on food intake in Quebec. When you look at statistics in Quebec, how kids are doing in terms of childhood obesity, fruit and vegetable intake, childhood obesity rates are lower in Quebec than they are in most other provinces. They have a higher intake of fresh fruit and vegetables. So, those are kind of positive indicators. It's hard to draw a direct line, obviously, to a policy, but certainly the policy is having an impact on the province.
So what roughly or approximately, I don't know if you have this information off the top of your head, are the obesity rates in childhood in Quebec versus Ontario, for example?
Yeah, I'm trying. It's in the low 20s in Quebec, I believe, so I'm remembering back, but I believe it's in the low 20s. As opposed to kind of, 20 in the kind of mid-20s in Ontario, but I could be off a few digits on either side, so.
So about 5 to 7%.
Yeah, exactly. There is, but as I said, you can't tie anything directly to one policy.
Sure.
And certainly policies in food and beverage marketing to kids, that's just one policy of many that are needed to have an impact on childhood obesity. So, but it's certainly an area where we can have an impact, so.
Chair, if we can get, I'm not sure if Diane has a copy of the presentation, but if that could be circulated to us, or if it has been, I'm not too sure. Okay. Okay, thank you, Chair.
Thank you very much. Member Lakin, do you have a question?
Thank you, Mr. Chair. Thank you for that presentation. In responding to Member Kakish's question regarding the impact on the Quebec experience on health outcomes, you didn't want to speculate as to whether there might be any specific linkages between the changes and health outcomes, but am I correct to assume that you did cite changes in food choices and food
Yes,
preferences
absolutely.
as a
So there
result?
was one study done, as I said, by Kathy Baylis and Dar, in, as I said, 2010, that did clearly link it to a health outcome. So it's just that type of research is much more difficult to do. So.
And so by generalizing then, is it fair to say that if one alters food choices through the use of changing marketing practices, that it's likely that health outcomes will follow, improved health outcomes will follow?
Absolutely.
Thank you.
Anyone else? No? I have one question for you, Ms. Kent. The packaging,
Yes.
what kind of an effect in your studies has that proven in terms of benefit to the child or not benefit to the child in terms of the packaging that they put out on the product?
Sorry, the packaging, just the impact of packaging?
Right.
I haven't done any research specifically looking at the impact of packaging. Most of the research looking at impact of food and beverage marketing has looked at television advertising, and the reason that there's been the most focus on television advertising is because that's where food and beverage companies put most of their money. So there was a huge study done in 2009, I believe, and then they did a follow-up in 2012. The Federal Trade Commission in the United States subpoenaed about 100 different large food and beverage companies in the United States. I wish the Canadian government would do this. And then they asked them to submit reports to the Federal Trade Commission showing exactly how much money they were spending in television advertising, digital advertising, how much they were putting into packaging, how much they were putting into all sorts of there's all these new types of marketing that are out there, from digital things to, smartphone advertising, sponsorship, et cetera, et cetera. And so most money is put into television advertising, but that doesn't mean that there's not an impact in the other areas. There's more and more research looking at the impact of digital marketing. And the techniques that are used in the newer forms of marketing are the ones that are kind of the most worrisome, because what I explain to my students is that marketing, right now is not like it was in the 1970s and 80s. It's not just a television commercial. They actually employ neuropsychologists to develop marketing campaigns. They run people through MRIs to see, okay, which part we're looking, for an emotional response to this ad. They pick their advertising campaigns based on the response. So it's not something that children can defend themselves against. It's not something that teens can defend themselves against. It's not even something adults can really defend themselves against. At least we know, though, at least what they're trying to do. So, but the techniques are very, very different. And there's also a huge blurring between kind of marketing and entertainment now. So it's often not easy, especially for young children and for teenagers, to distinguish, is this marketing or is this just content? They make it look like content, especially when you're looking at digital marketing. And so it's very, very difficult to defend yourself against that type of advertising. So.
Thank you very much, and thank you for your presentation this evening. Thanks for coming out.
Thank you.
Our next speaker is Marie-Christine Monkellen from Canadian Cancer Society. Welcome, Marie-Christine, to our board, and hopefully I did an okay job with your last name, and if I haven't, please correct me. Thank you.
Thank you, Mr. Chair. Councillors, members of the Board of Health, good evening. My name is Marie-Christine Monchalin, and I am a Manager of Public Issues for the Canadian Cancer Society National Office. CCS is pleased to speak today in support of the report, Healthy Eating, Active Living. We thank you for this opportunity. Merci de nous donner l'occasion de parler en appui de vos initiatives en faveur des saines habitudes alimentaires. CCS is Canada's largest national health charity. We are dedicated to finding new and better ways to protect the health of Canadians, shrink cancer rates, and reduce cancer's toll on our country. As Canada's leading cause of death, cancer is the very definition of a nationwide health issue. About 2 in 5 Canadians will develop cancer in their lifetime, and about 1 in 4 will die of the disease. Cancer cases are projected to climb by almost 30% by 2030. These statistics speak for themselves. More than ever, governments at all levels need to take action to prevent cancer before it starts. We know that about 1/3 of all cancers can be prevented by eating well, being active, and maintaining a healthy body weight. Besides not smoking, having a healthy body weight is one of the best things Canadians can do to prevent cancer. There is a link between obesity and increased risk of cancer. But unfortunately, this is something that the vast majority of Canadians are not aware of. Obesity increases the risk of at least 11 different types of cancers, including colorectal, breast, and uterine. Over the past 30 years, childhood obesity rates have tripled in Canada. From a cancer perspective, we are concerned because if children who are obese remain obese as adults, they are at increased risk of many chronic diseases, including cancer. A recent study commissioned by Heart and Stroke, CCS, Diabetes Canada, the Childhood Obesity Foundation, and Chronic Disease Prevention Alliance of Canada look at the impact of sugary drinks on our health and healthcare system. Sugary drinks are the single largest contributor of sugar in the average Canadian diet, and excess sugar intake is directly linked to excess weight. So what have we learned? Well, that over the next 25 years, it is estimated that sugary drink consumption alone in Canada will be responsible for obesity, almost 1 million cases of type 2 diabetes, more than 40,000 strokes, and more than 100,000 cases of cancer. We cannot ignore these alarming numbers. Of course, the causes of obesity are complex, and no one policy option will solve it all. We need a comprehensive approach. The Canadian Cancer Society is a proud supporting partner of the Stop Marketing to Kids Coalition. Along with almost 60 other organizations, we support the Ottawa Principles, which are meant to guide marketing to kids policymaking in Canada. We are pleased to see that the policies option put forward in the report align with the principles. We are also very pleased with the third recommendation of the report, which is to write a letter of support for the two bills currently in front of Parliament on marketing to kids. As said before, all levels of governments need to take action. Support for the current initiatives at the federal level is greatly welcome. Finally, CCS would like to underline your leadership in wanting to address the issue. We are pleased to see action coming from municipal governments in Ottawa, London, and Toronto. Policies that create a supportive, healthier environment can and need to be adopted by all levels of government, and it has. Ottawa has long been a national smoke-free leader. Ottawa paved the way for other municipalities and the province to adopt more restrictive tobacco regulations. It took leadership and political will, but it worked and paid off. Today, you have the opportunity to also be a groundbreaker in the healthy eating. The Canadian Cancer Society is ready to continue to support you in your actions in this regard. Thank you for your time. Merci pour votre temps et votre intérêt. La Société canadienne du cancer vous offre sa collaboration dans la poursuite de vos travaux.
Thank you very much, Ms. Monchalin. Any comments, questions? Seeing none, thank you again for coming in this evening, and thanks for your presentation.
Thank you.
Our next speaker is Manuel Arango. Welcome, Ms. Arango, and you have 5 minutes to address the committee. Thank you for joining us.
Okay. I was hoping to show a video. I'm not sure if you were able to load it or not.
We were not able to load the,
Okay,
your video on. We do apologize for that.
Okay, no problem. That means I get to talk slowly then. Mr. Chair, members of the Board of Health, I'd like to thank you for the opportunity to speak today on behalf of the Heart and Stroke Foundation in support of your Healthy Eating, Active Living consultations. We appreciate your efforts to protect the most vulnerable in our society, our kids, from the marketing of food and beverages. I hope to be able to get you to show you the video at another point in time. My name is Manuel Arango, and I'm the Director of Health Policy and Advocacy at the Heart and Stroke Foundation, and our organization is leading the fight against heart disease and stroke, and it has been present in almost every community across Canada for more than 60 years. We're proud to have volunteers in every neighborhood in Ottawa. We fund research, community projects, and public health initiatives across the city, ranging from research support for the University of Ottawa Heart Institute, the Ottawa Hospital Research Institute, CHEO, University of Ottawa, and we've partnered with Ottawa Public Health on a number of projects, including those related to the Champlain Healthy Schools project. We work closely with all levels of government to encourage the adoption of healthy public policies. The Heart and Stroke Foundation applauds your board for its recognition that marketing to children is a problem and that we need to reduce the accessibility of unhealthy foods and beverages on municipal property, and that we need zoning restrictions as well that can promote healthy diets for our kids. These are areas where the City of Ottawa can make a tangible difference right now. We've seen a dramatic reduction in death from heart disease and stroke, but we're at a pivotal moment in our work. Without meaningful action, much of what has been gained over the past decades is at risk of being lost. In particular, this is as a result of obesity, which is becoming quite problematic amongst children, teens, and young adults. And it's showing up at younger ages, and we've had a tripling in rates within the last generation. This, in part, is driven by a significant increase in the sale and consumption of unhealthy, highly processed foods and beverages over the last decades in Canada. Highly processed food sales have doubled from 30% to 60% of the average family's food purchases. Consumption of this type of junk food is associated with a higher risk of overweight and obesity. Obesity in childhood often tracks into adulthood and is associated with a magnitude of additional adverse health effects like diabetes, hypertension, heart disease, and some cancers. At present, over 60% of adult Canadians and over 30 of children, around 32%, are overweight or obese in Canada. Preventing chronic disease and obesity requires interventions at all levels of society, from institution, community, to all levels of government. It is widely recognized that chronic disease prevention and control requires much more than just providing education. We learned this in our fight against big tobacco. It's about making the healthy choice the easy choice. This means making healthy options more affordable, more accessible, more available, and promoting it and marketing them accordingly. It also means doing the exact opposite with unhealthy options. We need to reduce their affordability, their accessibility, their availability, and to restrict the marketing of junk food, including sugary drinks, to kids. Ottawa was a leader in tobacco control, and we hope it can do the same with the issue of children's nutrition. While declines in physical activity and increased sedentary behavior are key factors contributing to the rise of chronic disease, experts agree that poor nutrition is the driving factor behind ill health worldwide and the leading cause of obesity. Put simply, you can't outrun your fork. If you're over-consuming and drinking, for example, a liter of pop per day, you'd have to run a marathon per week to offset that. So nutrition is really important, and your intake is very important. We can't inundate our kids with advertising for unhealthy foods and sugary drinks at really cheap prices and then blame those children for wanting them. 90% of food and beverage that is marketed to kids are unhealthy. They're high in salt, fat, and sugar. The reality is that junk food marketing messages are drowning out any healthy messages that governments are making, health organizations, and parents are trying to communicate to their kids. It's an unfair fight, with marketing companies speaking directly to children and coming out on top. This puts parents at a severe disadvantage. Marketing to kids regulations will make a difference and level that playing field and give Canadian families a fighting chance. There's also significant public support among Canadians for restrictions on marketing to kids. In an October 2016 Polera public opinion poll of 2,400 Canadians, we found that 79% support restrictions on marketing of unhealthy foods and beverages to kids 16 years and under.
Can I ask you to wrap up, Mr. Rango?
Okay,
You're over the
I'll
time.
wrap up very quickly. And as well, 71% believe that because food and beverage spends so much money on advertising to kids, it has an unfair advantage over parents when it comes to influencing their eating habits. One final point that I'd like to make is with respect to job losses. The industry likes to say that restrictions on marketing to kids or sugary drink levies can lead to job losses. This is in fact not the case. We've heard this from the tobacco industry for many years. They continue to be very profitable despite regulations. And we also look at other jurisdictions such as the United Kingdom and in Quebec. There's been no impact as a result of the imposition of marketing to kids restrictions on jobs. Absolutely no impact whatsoever. The reality is that companies have to innovate and change their product lines all the time on an ongoing basis. So they're able to adjust accordingly, and there's been no impact on jobs. Thank you very much.
Thank you very much. Any questions, Councillor Taylor?
Thanks very much, Mr. Chair. Mr. Rango, thank you very much for the presentation. It was the Heart and Stroke Foundation's report that actually spurred me to move the motion that the board supported that brought us to this point today. I'm curious, you know, from your perspective, it seems since the report came out that obviously there have been, you know, some of the delegations here tonight referenced the report. We've only been through a few so far. What's the reception been, and what's the reception been, you know, from the community, but what's the reception been from governments at any level thus far to the report that the foundation issued?
It's been very positive. First of all, from a media point of view, we actually got 94 million impressions as a result of the release of that report. And we do our Heart Month reports every year in February, and this was the highest media attention we've ever received. So it definitely resonated with the public and with the media. With respect to government, Health Canada did indicate that the report was very much appreciated. As you know, the federal government has made a commitment to address marketing to kids, restrictions of unhealthy foods and beverages. So the feedback we got from them was very positive as well.
I guess my question was kind of, from the government standpoint, that was one track. The other was with respect to, you mentioned the impressions you were getting on the media, and media impressions can happen for a number of reasons. That people can like what they hear, they can not like what they hear. If the board moves forward with our consultation strategy tonight, we're going to be embarking on consulting residents of Ottawa. So I'm wondering if you have a sense of a précis of what that consultation might yield. I mean, we'll go and do it, in Ottawa if the board supports this, but I'm wondering if you have a sense from residents across Canada, what they have perhaps offered.
Absolutely.
Positive or negative.
Right. So I did have to cut off a little bit of my discussion with respect to public support. And as I mentioned, there is high public support across the country for this. And we've been doing polls on this issue for many years in Canada, for a good 15 years, and we consistently get support around 80% for restrictions of marketing of unhealthy foods and beverages to kids. And Canadians, as well in our polls, we have seen that parents do and Canadians do believe that most of the food that marketed to kids is unhealthy. And they feel that they're exposed to too much advertising by the industry. And I did mention also as well that they feel that it's really an unfair fight. The industry has billions of dollars that they put into this marketing. And on the health side, we don't have that much money to invest. A lot of our health promotion efforts, they consist of health fairs or presentations to kids at school, which are very important. That's the starting point. But you can't compare that to the billions of dollars that the industry puts into this. So we need to curtail that, and Canadians support that. And I expect as you move forward with consultations that you'll receive great public support.
Thank you very much. Thank you, Mr. Chair.
Any, Member Tilly?
I think you may have just covered it in a lot of it in your last response, but I'm hearing about the diabetes, the obesity, yourself, heart and stroke, cancer, and all these effects, certainly by the choices, and you've mentioned the challenges of the food and beverage industry and the dollars they can spend, the billions of dollars on marketing, and it seems like what we're hearing about is policy and restrictions and coming up with policy that will restrict some of that possibly. But what about countering the other piece, the awareness coming from that side other than presentations in schools? Do you think the possibility of funding is there? Unfortunately, I guess most foundations, you're raising money for research, and to go back into those issues, is there ever, do you think the opportunity, I can't see foundations bonding together, but to raise awareness and counter some of what the big industries are doing to counter that and bring awareness to children and youth and parents that, hey, make healthy choices? Do you think the option's there?
Absolutely. We do like to work together in conjunction with government and with all the health organizations. By working together, we know we can have an impact. That said, we're still at a huge disadvantage because the industry has billions of dollars. But there are some innovative campaigns out there. For example, in the United States, they have done some counter marketing, for example, of baby carrots. It's a kind of really neat ad. And so, if we had more of that type of thing, it would help to counter the money that the industry can put in there, but it's just an uneven playing field. So that's why we need restrictions, and it's been effective in Quebec. And if I could just add, there was a question asked to Dr. Monique Potvin Kent too as well about the efficacy of the Quebec legislation. So we know that in Quebec, amongst 6 to 11-year-olds, obesity rates are around 18%, and across Canada, it's well over 30%. So that's pretty significant. As well, they have the highest fruit and vegetable consumption rates in the country. And we know that after the implementation of the legislation, there was a 13% increased probability of consuming less fast food in that province. And so that's pretty impactful stuff.
Anyone else? Not? Thanks very much for coming and joining us, and thanks for your presentation.
Thank you.
Our next speaker is Alex Munter. He's the President and CEO of Children's Hospital of Eastern Ontario. Good evening, Alex, and welcome to the board meeting. And 5 minutes
Thank you very much. And it's a 1-2 punch from CHEO tonight. I'm joined by Dr. Anik Buchholz, who's a psychologist with our Center for Healthy and Active Living, and she'll be speaking after me. And I'm here on behalf of our board of directors to let you know that CHEO and the Ottawa Children's Treatment Centre have endorsed the Stop Marketing to Kids Coalition and support the direction outlined in the report before you. How many folks here watched Mad Men, the TV series? Yeah, most people. So one of the things that's noticeable about it is the degree to which, when you watch Mad Men, they are bathed in smoke. They're smoking while they work, while they eat, while they walk down the street, and it's a snapshot. We can see from the visual that it's another time and place. And we are living in our own Mad Men era when it comes to the food environment. And 20 or 30 years from now, people are going to look back, and they're going to wonder about the fact that we made a mystery of the nutritional content of the food we eat, that we allowed multi-billion-dollar corporations to market at 3-year-old children, that we created and allowed a culture of obesity to persist. And you've heard the stats, I won't repeat them, in terms of the rising prevalence of overweight and obesity. I went to a retirement party a couple of years ago for a nurse who in the diabetes clinic, Suzanne probably knows her, Nikki Dolan, who started there on day 1 of the hospital in 1974 and worked basically in the diabetes clinic her entire career. And when she started, there were only kids with type 1 congenital inborn diabetes. And as she retired, the business of that clinic is increasingly about type 2 diabetes. We now have an obesity management program that you're going to hear from. In a moment, the Hospital for Sick Children in Toronto does bariatric surgery, weight loss surgery on kids. In the state of California, which is roughly the population of Canada, the majority of adults have either type 2 diabetes or prediabetes. So think about that. In California, if you are an adult without diabetes, you are in the minority of the population. So this is clearly a trajectory that is a moral issue, because obesity will deprive millions of children of the healthy future they deserve. And also it's a financial issue, because obesity and chronic illness are poised to really break the back of the healthcare system. It is not an aging population, which our system can retool itself to respond to. But when 2 of every $3 in our healthcare system are spent to treat chronic disease, that is a burden and a pressure that we can't sustain. So I was proud to be co-chair of the Healthy Kids panel, which reported 4 years ago, which recommended a ban on marketing at children and point of sale targeting of children. And I would reinforce those who remind you that Ottawa was a leader when it came to tobacco and smoke-free workplaces and public places. And there's quite a hullabaloo about it at the time, as we became the first big city in Canada to adopt such regulations and keep them in place. And I remember we said at the time that someday people would look back and wonder what the fuss was about. But first we had to have the fuss. And today nobody seriously advocates for bringing secondhand smoke back into workplaces and public places. And someday nobody will advocate for the marketing of junk food at children. But first we have to have the fuss about it. So congratulations for, once again, Ottawa Public Health playing an important leadership role in a very crucial child health issue.
Thank you very much, Mr. Munter, for presenting this evening. And Member Fleury. Question.
Merci, Alex. C'est plus un commentaire, évidemment. Pour moi, tu es un modèle ce que tu fais dans la communauté, mais aussi de ce que vous aviez fait quand vous étiez au conseil face à la cessation de fumée, puis toutes les initiatives. Donc, merci de prendre le temps aujourd'hui de demeurer impliqué, puis de nous rappeler l'importance d'être à l'avant-garde, de ne pas attendre que d'autres juridictions prennent le devant là-dessus. Alors, je pense que ça souligne évidemment ce que d'autres disent là, ce soir, mais il y a une crise, puis si on ne réagit pas, on va continuer à être dans une situation chronique qui, aujourd'hui, est sur la ligne là, de ce qu'on peut voir là, avec les experts. On est à la ligne de voir vraiment des situations qui demeurent encore plus sévères. Alors, je l'apprécie, merci, puis on va avoir besoin de ton aide pour naviguer tous les processus législatifs avec nos partenaires à la province et au fédéral. Alors, on compte sur toi.
Merci. Le
Merci.
tuyau sera là.
Member McKinney?
Thank you. It might be not a fair question to you, maybe the person coming up behind you, but I just wonder if you, just in your assessment of what we're looking at today and the options that we're looking at today, I know that there's a bill in the House of Commons that actually looks at implementing measures that prohibit advertisers from targeting kids through such means as, school activities, sponsorships, sports sponsorships, actually, I think is to be specific, and the internet. And I just wonder if you see a role for public health in going that one step further to make sure that, because we don't see it. We don't see cigarette advertising with our sports sponsorships anymore. We used to. We don't see it. It's not just in schools and in municipal facilities where kids are, but, is it time for us to start looking at something a bit broader that really, will rip off the Band-Aid and have the fuss all at once, I guess is what I'm asking.
I think the city can and should play an important leadership role. I can't remember who said it. A previous speaker said that restrictions on marketing to children won't stop obesity alone. And just as the City of Ottawa bylaw didn't curb smoking rates on its own, but it was part of a group of measures over time in terms of regulation, social marketing, restrictions, taxation, all of which together had the effect of dramatically decreasing smoking rates in this community and elsewhere. And it's going to need to take the same approach of putting kids on a path to lifelong health, changing the food environment, and building healthy communities to achieve this goal. And absolutely some of the measures that are being taken here and elsewhere are pointing the way.
Thank you.
Member Lakin?
Thank you, Mr. Chair. Just a note of thanks. Your presence here reiterates something that for the board is worth reinforcing, that as the CEO of a hospital, albeit in this case a children's hospital, but as a CEO of a hospital, your presentation reminds us that many diseases are preventable. And preventable by starting young, and preventable by trying to alter behaviors and other factors that are not set in stone. So your presence is helpful for us in many respects, but particularly in reinforcing that message, and it gives us pause to reinforce what we do. Thank you.
Thank you.
Thank you, Member Lakin. Anyone else? Member Kakish?
Thank you, Chair, and thank you very much, Alex, for being here. And I have to agree with what Member Leakin was saying about the importance of having you here as the CEO of the local children's hospital here. I was just wondering if you have any stats or data on the obesity rates that you see in Ottawa, and to pick up on a bit of what Catherine was saying in your interaction, I'm sure you see lots of parents and children on a regular basis in terms of what you touched on it briefly, but if you can elaborate on what other things or factors would help that. I mean, we saw in the presentation from staff the sort of pressure on parents, or they're bombarded by the access to a lot of these junk foods
Right.
and to a lot of the sugary products and that. So if you can just give us some of your insights in terms of what you see when you talk to parents, what other measures other than the marketing that could be beneficial to,
Sure.
to deal with this issue,
Sure.
and any rates, data or stats that you may have.
Yeah, so
on
you heard a
obesity.
little the prevalence data of 1 in 3 kids are either overweight or obese. When we put together the Healthy Kids strategy 4 years ago and did extensive consultation here in Ottawa and across the province, talking to parents. And parents told us that there is, not a surprise, nothing that matters more to them than the well-being of their children. And that they felt in a constant struggle with the outside world trying to achieve the goals of healthy eating and nutrition. And so I would encourage you to read the report because we wrote it with the voices of parents and caregivers and with their advice in mind. And so talking first of all about putting kids on the path, a lifelong path to good health, which really starts prenatally. And when kids are born, so even things like, for example, access to prenatal education, which in Ontario is highly variable in terms of quality and accessibility. Changing the food environment, and so that is about availability of healthy food, affordability of healthy food. So I think of the van, the bus. I forget what you call it. It's got a, sorry. Right, the market mobile as an example, but the issue of access to nutritious food, television marketing, point of sale marketing, and all the versions of trying to influence children. And then finally, building healthy communities and building, and that's how we design our cities and creating opportunities for physical activity. But this is not, we are not going to be able to educate and exercise our way out of the obesity epidemic. It is going to take government taking action to make sure that we change the food environment to be able to support healthy choices and to support parents and families raising kids.
Mr. Munter, I just want to thank you for all your work that you do, not only at CHIO, but in through the community and have done for years. So thank you once again for all of that, and thank you for joining us this evening.
Have a good evening.
Our next speaker is Dr. Annick Buchholz, from lead psychologist from CHIO, Center of Healthy Active Living. Good evening, Ms. Buchholz, and welcome to the board, and thank you for taking the time to come present to us.
Okay. Good evening. On behalf of our clinical team at the Center for Healthy Active Living at CHIO, I thank you for the invitation to speak this evening. I'm a clinical psychologist, and I'm the lead in research at the Center for Healthy Active Living, which is CHAL. And CHAL is a provincially recognized center of excellence for the management of pediatric obesity in Ontario. We are an interdisciplinary team working with children and youth living with severe complex obesity and their families. And prior to working at CHAL, I worked with youth with severe eating disorders and their families for many years and was involved in the development of the inpatient and day treatment programs there. The eating disorders and child teams at CHIO have been working closely over the years and have come to recognize the importance of shared messaging around food, nutrition, weight, and health, both in the treatment and in the prevention of these conditions, serious conditions. We recognize that there are important genetic, biological, and psychosocial risk factors, shared risk factors, in these two patient populations. This includes the environment whereby there are often confusing messaging and advertising around weight and health. I think it's important to remember that you can be living at a higher weight with obesity and be healthy, just like you can be living at a lower weight and be very unhealthy. We support the recommendations in the report made to the Ottawa Board of Health to restrict the marketing of food and beverages to children. Given that the current messaging around health and weight is often confusing to adult influencers, children are indeed a vulnerable population to this type of marketing. Low-income families are also at risk given financial, sometimes geographical, and other barriers to food and beverage choices, and we need to remember that. In summary, we feel that all children and youth and their families should have access to community and school environments that foster positive eating behaviors, positive nutritional choices, and other important health behaviors, including active lifestyles, great stress management, sleep behaviors, reducing sedentary behaviors, etc. Thank you.
Thank you very much, Dr. Butch-Holt. Any comments or questions from board members? Member Lakin?
Thank you, Mr. Chair. Thank you, Dr. Buckholz. I want to make sure that the board and staff heard an important message that you just shared with us, and make sure I have it right if I could repeat it, that in supporting the initiative to restrict marketing of unhealthy food and beverages to vulnerable populations, that we do so on the basis of improving health for all children and youth. And the focus on obesity may create the wrong message, perhaps maintain stigma that ought not to be there. And so just to be clear, you're supporting the initiative as a health improvement strategy, not specifically for one disease category.
That is correct, Dr. Lakin. Yes.
Thank you. If I could just, I will have a chance to come back to that comment when staff return. Yes?
Yep. Thank you. Anybody else? If not, thanks again, Dr. Buckholz, for coming in this evening and joining us. Before we move on to our next speakers, we do have to extend the meeting request, so we have a motion from Madame Pinel.
Thanks, Chair. Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant to subsection 81C of the procedural bylaw. Merci.
Is that carried? Thank you. Our next set of speakers is Carolyn Mondu and Margaret Hughes from the Dietitians of Canada. Welcome, ladies. Just press the button on the microphone, and you have 5 minutes to address the board. Thank you.
Thank you, Mr. Chair. Bonjour, je suis Caroline Mondu, and this is Margaret Hughes. We are members of Dietitians of Canada, the National Professional Association for Registered Dietitians. Dietetic practice at the provincial level is regulated through the College of Dietitians of Ontario. We are here today as local dietitians and are delivering this script on behalf of Dietitians of Canada who could not be here today. To begin, I would like to congratulate the City of Ottawa on your forward-looking proposal. The proposed plan to consult with stakeholders in your local area about a list of policy options prepared by public health staff takes a systems approach to developing comprehensive and coordinated policy. This approach will fit well with the provincial actions such as the menu labeling in Ontario restaurants and with Health Canada's healthy eating strategy. It takes a multi-pronged approach to support healthier eating environments. Today, I will speak to Dietitians of Canada's position on marketing to children and sugar-sweetened beverages, and our recommendations to promote healthy food environments. In our definition of food environments, we include all places where children and adults eat, play, learn, work, and live. Certainly, the municipal properties and child-focused settings named in your plan represent important settings for children and also for adults. This will be important as part of your strategy, to aim for a policy that is comprehensive, covering a variety of settings within your municipal mandate, to improve the availability of healthy foods and beverages. Such a suite of policies will level the playing field, so to speak, by introducing standards that clearly define food and beverage consumption and marketing practices across the city. Collectively, the combination of standards and buying power of Ottawa's public institutions could become a goal for reformulation of products where certain products do not meet the procurement standards. Consistency amongst these food environments will provide an example to consumers of healthy foods and drinks, and it will make healthy eating the easy choice. Dietitians of Canada is a partner in the Stop Marketing to Kids Coalition that released the Ottawa Principles, of which you all have copies. We call for policies and regulations to effectively protect children from all commercial food and beverage marketing. In September, we supported Senator Nancy Green-Rain's Bill S-228 to prohibit food and beverage marketing to children. We understand you are considering the same action today and strongly support such an action. In our analysis of the scientific literature, however, we concluded there is strong evidence base to support age 16 and not age 12, as stated by the Canadian Children's Food and Beverage Advertising Initiative, as the time when children are mentally and psychologically ready to be able to distinguish marketing from educational messages. We have advocated for this change, which will be considered when the bill returns to the Senate later this spring. Health Canada has recently proposed front-of-package labeling, which will apply to all prepackaged foods, clearly identifying products with high levels of sodium, sugar, and/or saturated fats. The standards used for this federal regulation could be applied in your future definitions as you seek to limit access to food and beverages high in salt, fat, sugar, or calories on municipal property. And I turn it over to Margaret Hughes.
Thank you.
You have a minute and a half left.
Thank you. Healthy food procurement policies which support procuring, distributing, selling, and/or serving healthier food in public settings have emerged as promising strategies to promote healthier food environments. These policies can positively impact sales, intake, and the availability of healthier food. Our association's position on sugar-sweetened beverages and taxation, endorsed by many other health organizations, emphasizes the negative impact of these products on the health of our population. For the greatest impact, we acknowledge that measures such as taxation should be combined with other policy interventions. Specifically, we support increasing access to healthy foods while decreasing access to unhealthy foods in schools, daycares, and recreation facilities, in addition to the restrictions on the marketing of foods and beverages to children and effective long-term educational strategies. Once again, we commend you on your proposed plan to investigate a suite of policies that will support healthy eating environments, where it will be easy to make healthy food and beverage choices that contribute to dietary patterns that decrease the risk for chronic disease and promote wellness. Your policies, coordinated with the policies and regulations at the provincial and federal levels, could make Ottawa a city that consistently promotes health and well-being, serving as an example for other communities in Canada, many of whom are currently considering similar policy direction. I would like to thank you on behalf of Caroline and myself for inviting us to speak on behalf of Dietitians of Canada, our national association, and as local dietitians from the Ottawa Dietitians Alliance. We are confident that this initiative will only better the health and food environments of the children and citizens of Ottawa and one day our country. Thank you.
Thank you very much, ladies. Anybody questions or comments? Seeing none, thank you again for coming this evening, Ms. Mondo and Ms. Hughes. Thank you. Our next speaker is Jim Shepard, representing himself as a parent. Good evening, Mr. Shepherd, and welcome to the board. And you have 5 minutes to address the board.
Thank you. Good evening. My name is Jim Shepherd, and I drove from Toronto today to talk to you about my son, Brian. This picture was taken This picture was taken on January 6, 2008, the day that I lost a vibrant, healthy, and much-loved 15-year-old son. Brian died from an unexplained arrhythmia several hours after reportedly drinking an energy drink provided to him by Red Bull representatives. They marketed directly to my son. After 9 years of research and weighing the evidence, I suspect even more today that that energy drink was at least contributory to my son's death, if not the whole cause. I tried to distill the essence of my research into the submission I made to this committee. My research revealed 5 major things. 1, I learned that my son's death was not the first suspicious death, nor has he been the last. I connected with other families that have suffered similar tragedies. They all share my suspicions. Health Canada's adverse reactions database has 3 deaths associated with energy drinks, all teenage deaths. Joseph and Brian are 2 of those. It is noteworthy that Health Canada estimates that for every adverse report on file, up to 10 go unreported. My research strongly suggests that the unreported number may be much higher. 2, energy drinks are marketed to children and youth. These are some of the many instances I've encountered. While the Canadian Beverage Association claims that they do not market to those under 12, the British Soft Drink Association states that they won't market to those under 16 years. Even if not directly marketed to, children and youth are bombarded with all the trendy and adventurous marketing associated with these drinks. 3, industry claims that the typical energy drink is 80 milligrams of caffeine, but the typical energy drinks I find on store shelves have much higher concentrations. There are 23 energy drinks on this shelf that have between 150 and 180 milligrams of caffeine. This is the range of danger that we're talking about. Experts continue to question the safety of the combination of ingredients in energy drinks, not just the caffeine. 4, statistics from a number of sources demonstrate that children and youth are drinking energy drinks. 5, there's no long-term studies to prove the safety of energy drinks. On the contrary, what is emerging strongly suggests a public health threat. A 2010 Health Canada appointed energy drink expert panel came back with very strong recommendations, most of which were ignored by Health Canada and the Harper government. These are a few of a growing consensus of experts echoing the need to protect children and youth from these potentially dangerous products. As you move forward with city initiatives to reduce marketing to children and youth, I ask you to take special consideration to energy drinks. Energy drinks are the worst case example of the marketing of an unhealthy and a potentially dangerous product to youth and children. I was deeply saddened by the recent Red Bull crashed ice event here in Ottawa. My concerns are outlined in a letter that I sent to this committee, addressed to Mayor Watson. This is a perfect example of industry's insidious marketing methods. More disturbing is that the city partnered with Red Bull, endorsed the drink's safety, and provided them with a podium to promote their dangerous product to countless children and youth. Ottawa events such as this are in sharp contrast and will negate the initiatives being discussed today. Moving forward, I'm asking that the City of Ottawa protect children and youth by 1, banning the sale of energy drinks on city properties and agencies, following the lead of 80 Quebec municipalities. 2, ban sampling and marketing in the same way, including at city events. And 3, mandate an education plan in local schools. And 4, implore higher levels of government to step up to the plate and do their part. Thank you for your patience and for the opportunity to speak today, and I welcome any questions you might have.
Thank you very much, Mr. Shepherd, and thank you for your effort to come here this evening, traveling from Toronto, so thank you for that. Any questions or comments for Mr. Shepherd? Councillor Chernisheko?
Thank you very much. Thank you for going to the time and trouble, and I'm very sorry for your loss. You have confronted something that's very hard to do. You've taken on the cool factor, and that's really what we are confronting here, which is Red Bull is trendy. Sports drinks are trendy. Fruit to go is trendy. Little yogurt drinks in a bottle are trendy. And it is hard for those of us who are aware of what's actually in them and what they're actually doing to the body to take that on. And you know, witness the success of the city's Red Bull event here, and yet what was underlying that. I don't think I really have a question for you here other than say thank you for doing that. As much as I loved the sport spectacle of that recent event, there was something in me that was troubled the whole time. Stayed silent because everyone else was having such a good time, and it was so cool to have that event here in Ottawa. And yet the slightest bit of research in what's actually in those containers. My adult 24-year-old son and his girlfriend attended the event and walked out with pockets full of sample drinks. Those of us who were in the city, the hospitality suite that a number have had access to, were served beer, water, anything in Red Bull cups. And the menu included quite a number of mixed drinks that had Red Bull as its sort of main content. I've isolated one particular company here when there are many others out there, as you've pointed out. So I think that what we're looking at here today, when it comes time to defining what we mean by protecting vulnerable populations, marketing of foods and beverages, what exactly it is that we are restricting, I think we have to be very aware that it's not just about the sugar, and you are the one, maybe the only presenter tonight to particularly focus on that. Thank you for it.
No, you're welcome. Thank you very much for your comments.
Thank you. Member Tilley?
Jim, I'm so sorry for the loss of your son Brian as well, too. It pains me. I have a 21-year-old daughter, so I can't imagine. I wonder if among your studies, when you're looking at the dangers, and that's the warning you're putting forth here, has there been much information on the possible addictive nature of that jolt, that high yet? Have you come across that in any of your research? It sounds like it's extensive. I'm worried more amongst, late teens, early 20s, and that is there an addictive component to that high, obviously that rush that you're aware of?
There is literature speaking about the fact that caffeine is mildly addictive, and certainly you look at these energy drinks have been considered stepping stones, suggested as stepping stones to harder drugs. The student surveys show that they're being used with alcohol, quite widely used. I could get figures for you, but I have to dig for them. But definitely there is an addictive nature to caffeine, and they have been related to traumatic brain injuries. So there is a bigger picture here, and it's certainly different than coffee. The common comparison is coffee, but once again, we have a totally different product and a totally different marketing scheme, and it's a trendy product. I don't think someone would chug a coffee before going out on the hockey rink.
Thank you very much, Member Tilley. Member Taylor.
Thanks very much, Mr. Chair and Mr. Shepherd. I think every speaker tonight is going to open by saying we're profoundly sorry about the loss of your son, and thank you for coming and sharing your insight and a tragic experience with us here tonight. And I know you gave us your submission, which really focuses around the energy drinks and the presentation that you gave. And as I think you're aware, what's at least before us today is our municipality's first foray into the, the marketing to kids piece. And I'm interested not so much in what you learned post your son's passing, but pre. Could you tell us a little bit about, was marketing to children or healthy eating or, what choices to make or not, what was life like before he passed? What was life like, would you have considered yourself, I was never aware of things like this before, which I think would be most of us. We don't think consciously we're being marketed to. I'm interested in your thoughts about what you learned versus what life was like before. You must have learned a tremendous amount about how you were being marketed to, how he was being marketed to, without being aware of it.
Yeah, certainly. That's a very good point. Number one is that I've always been an advocate for the marketing to children. We've tried to cook from scratch at home, when the kids were young, and provide them with good nutrition. And it was always a challenge because you're always fighting. You're always fighting with, as the points have been made previously, you're always fighting with industry on that note, with them wanting this junk food or that cereal. And you look at the ingredients, it's might as well just give them a bowl of sugar. As far as my knowledge of energy drinks, I had the usual discussion with my kids as anyone else does with sex, drugs, tobacco products and the like. I never mentioned energy drinks because I wasn't aware. I wasn't being marketed to. And for a brief moment after my son's passing, yes, I felt guilty. And then I started sharing my story with other parents, and they say, oh, you mean like Gatorade? I said, no, I don't mean Gatorade. I mean something with stimulants in it, caffeine and other stimulants in it. And I learned that I wasn't the only one. Virtually everyone I talked to, and I still meet people today, it's common to meet people today that aren't aware of the potential dangers.
Okay, so I guess what I was trying to get at, and thank you for that, is, your life prior to your son's passing, it sounds like you considered yourself, and you were, kind of an aware, educated parent, conscious of healthy eating, active living. I'm trying to weigh that against, would you consider that you had an above average level of awareness in your household? Because if you did, and you still were marketed to, I think that speaks loudly to people who perhaps are not as aware.
Certainly. That's, I guess, what outraged me was the fact that I was so against the general marketing, and then this took place. And this, to me, is the worst case scenario, no doubt, and obviously the outcome and what I suspect. But we need to stop this. You looked at the heart and stroke statistics, and it was in the top 5 for children marketing Red Bull. And ask Red Bull, they don't market to kids, right? Because they're a member of the Canadian Beverage Association. They don't market to kids. But there's lots of examples out there where they do. Actually, at the Toronto Board of Health meeting just 2 weeks ago, I spoke, and there were teachers there, and there was submissions alleging marketing to children as well. And I've seen it on since then. I've seen it on municipal properties in a hockey arena. I watched my 12-year-old nephew's hockey game, and I come out in the parking lot, and Red Bull's handing out drinks in the parking lot. So,
Mr. Shepherd, thank you. Thank you, Mr. Chair.
Thank you, Member Taylor. Member McKinney.
Thank you, and thank you for the submission that you sent earlier. I did read it, and I just wonder, go back to what Councillor Chernyshenko was saying about, we're up against the cool factor. We're also up against the money factor. Put that on the table, right? We don't invite sponsorships into the city just because they're cool, but we do it because they give us money. And Red Bull is one of those. So I just want to go back to a question I asked earlier about the bill that's making its way through Parliament right now, and where it would actually address implementing measures that would prohibit advertisers, such as Red Bull, targeting kids through sponsorships, such as sports sponsorships. And do you think that, is it your opinion that we would be able to capture Red Bull and other caffeine drinks who claim not to be targeting children, but in fact are, in a strategy such as that, where we actually include not just on municipal properties, but through school activities, through sports sponsorships, through the internet. Is it your opinion, just in, you know more about this than than I do, certainly. I won't speak for everyone else, but do you think that it would capture drinks like Red Bull and their means of advertising to children?
I'm sorry, do you mean would regulating it be effective?
Yes.
That's what you're asking?
Yeah.
We do need stiff consequences for this. To give you an example, when my son received the sample of the energy drink, it was actually against the Food and Drug Act because it was a natural health product to receive a sample. You can't give out samples of energy drinks at that time. And I filed a complaint, and it took them 8 months of playing with the litigation back and forth. The Red Bull legal department said we weren't sampling, we were freely distributing it. Okay, and there's a distinction, like you give freely distribute it to Health Canada to test a drug, but you don't give them a sample because you're not allowed to sample, right? So there's a game with words. But it took them 8 months to determine that my son was sampled to. So what did Health Canada do? They convened an expert panel in 2010, and the expert panel came up with very strong recommendations, including stiff penalties for regulations. And what Health Canada did a year later was ask industry to develop a code of practice in regards to marketing and sampling to children. It hasn't changed to date. It's still 12 and under, and it's a voluntary process. So yes, we need stiff penalties, because right now the regulations are mere words, and industry is doing what they want. So as a broad spectrum for whatever we're talking about, if there's a loophole, I believe industry will find it, and we need regulations with stiff penalties.
Thank you.
Thank you.
Anyone else? Not? Thank you again, Mr. Shepherd, for coming in. And thank you for sharing your story, although a sad story, but we do appreciate hearing it. Thanks for all the input that you provided this evening.
I just have to save one life.
Moving on to Bill Jeffrey, who's Center for Health Science and Law, here to speak. Mr. Jeffries, thank you for coming in this evening, and you have 5 minutes to address the board, please.
Thank you, Mr. Chair. I would like to make some general comments about both marketing to children I've circulated speaking notes with a number of very specific points, which I wanted to share with the board. But in consideration of the fact that you're really just considering a motion to hold a consultation, I won't go into those in great detail. I just want to mention some concerns I have about the consultation being structured in such a way that it confines the scope of what might be considered. And so I'll just give you some examples. In the Board of Health report, there was much discussion about this notion of ultra-processed foods, which I think there's a growing recognition isn't a very good way in countries like Canada for discriminating nutrient-poor foods from nutrient-rich foods. Secondly, foods that are high in fat, sugar, and salt is a concept that underpins the United Kingdom restrictions on advertising directed at children, but most independent dietitians would accept that people should be consuming more unsaturated fats and less saturated fats, and so in a way, focusing on fats is confusing. And also, not all that ails us from a dietary perspective involves obesity. According to the Global Burden of Disease report, data for Canada, a great amount of diet-related disease kills about 50,000 Canadians every year. It has to do with inadequate fruit and vegetable consumption, inadequate whole grains and legumes and nuts and seeds and that sort of thing. It's not all just about the amount of sugar and calories and salt and so forth. And lastly, and this comes back to what Jim Shepherd was saying earlier. Toronto Public Health even and others refer to these so-called caffeinated energy drinks, but I'm not persuaded that it's about the caffeine or exclusively about the caffeine. There are these other untested substances that are included in those products. So just in terms of specific points about marketing to children, I don't know if you noticed the subtle differences in the way that some of the deputants were speaking about this or the different approaches that were referenced in the staff report. But there are basically three approaches to dealing with marketing to children. The Quebec approach, which is a ban on marketing all products or advertising all products directed at children, not just foods. There's the approach that is reflected in Senator Rain's bill currently, which is to restrict all food advertising. And then there's the approach that was reflected in the federal government's election platform, which is restricting junk food advertising. Those are three different approaches. I think the two that focus on foods are very vulnerable to legal challenge, which in ways that I could describe to you, or they're detailed in the report. I think the Quebec approach is much better, and if we extended the ages to older children. In fact, the Ontario law considers children to be anyone under 18. And so I just would urge the board to ensure that the consultation doesn't restrict consideration of those aspects. And then lastly, just to underscore, I guess from an evidence perspective, some of the points that Jim Shepherd was making earlier. I did do a review of the adverse reaction database, and it's a very important point to make that often databases like those where it relies on voluntary reporting grossly underestimate the size of public health threats. But just to benchmark it for you, if you look just at the age range between 12 and 25, which I think we can all agree is a very young period in life to have cardiac disorders. There were 112 reported severe adverse reactions due to cardiac disorders in the past decade in the adverse reaction database. And of those, 10 were due to energy drinks, and approximately 10 were due to all other over-the-counter drugs, and the remainder of the 112 were associated with prescription drugs. So this could be a very big problem that's been grossly underestimated by other public health authorities, and I think it's incumbent on Health Canada and other public health authorities to, I think, raise some alarm bells about this, and it may be that the database is flawed in some way and over-representing, but it does seem that there's reason for caution there.
Mr. Jeffrey, you have 10 seconds.
10 seconds? Okay, well, I'll just, underscore that this isn't just a problem for children, the energy drinks. If you look at the adverse reaction database and the expert report, you can see that these serious adverse health reactions have occurred in people between the age of 13 and 68. So it's not just about children, and I hope that the consultation is open to considering that sort of thing.
Thank you very much. Any questions? Member Kakish.
Were there any points that you wanted to cover that you didn't get to cover in your 5 minutes?
Well, look, it's a pretty comprehensive technical brief, but I would say that I agree with the Ottawa principles. You all have a copy of those. I have had a number of conversations with the proponents of the Ottawa principles to underscore that, but I disagree with what they're proposing in terms of a policy result. For many years, they advocated a restriction on junk food advertising, and then about 2 years ago, it was restrictions on all food advertising, and now it appears clear that there will be some horse trading over Senator Rain's bill. She was focused on all food, and maybe they're going to steer toward junk food advertising. And I'm very concerned that it's vulnerable to legal challenge. And as you saw earlier today, your own city is being challenged for the water rules. Irwin Toy was a toy company that challenged the Quebec law, and it was appealed all the way to the Supreme Court. They used all of their resources to do that, and ultimately the Supreme Court held in favor of the law, but it took some doing. Now it's kind of a pillar of Canadian constitutional history. I'm worried that these other two approaches that focus on aspects of food are not just vulnerable to legal challenge, but also they're vulnerable to being exploited as loopholes. For instance, if you have a marketing ban that's based on the amount of sugar in a product, what's to prevent Pepsi or Coke from just doing brand advertising? And what's ever to prevent McDonald's from doing like place advertising as a restaurant? They could advertise a salad on Saturday morning cartoons, and the kids are going to tell their parents, let's go to McDonald's, they got salads there, you like those, and get me a Happy Meal kind of thing. We have to be cautious about assuming that industry will passively follow whatever your best hopes and expectations are for the rules. It just doesn't happen that way.
And that's a good point, and I think we see that with the tobacco industry. We get one step ahead of them, and then they get 2 steps ahead of us, and then it's that cycle, and we see that regularly. And like you said, it's all in the marketing and the branding and the packaging and all that. And I'm sure, those are some discussions I think that we'll have when we start asking staff, and when we get, like you said, this is very preliminary at this point, but how do we make it strong in terms of being appealed down the road, right? And with the water pipes, I think I'm not too worried about that, because I think precedent has been set where generally the courts side with the city or the municipality in those cases. But I mean, I think that's a good point, and those are some of the discussions that we need to have to make sure that legally we're in pretty solid shape for any appeals or down the road. Thanks again.
Thank you, Member Kakish. Member Taylor?
Thank you very much, Mr. Chair. And I guess, I share Councillor Kakish's, thoughts about the parallel to the smoking issue that we've had. In fact, we sat at this very table and kind of pressed staff on, are we tight enough with smoking? And then it became, we'll add in boiling it, and then we'll add in vaping it. And, the constant change of the language was what kept the industry kind of a step ahead of us in many respects. I guess my question, to perhaps address your thought, is more directed at Dr. Levy, and it's as we embark on this consultation process, not expecting what we're going to hear, but not being sure of it yet. If the consultation starts to lead us in other places, do you believe that it's sufficiently broad enough structured that your staff can bring back to us what they hear and not simply dispose of things because they don't fit into the boxes that we pre-designed?
Thank you very much. In short, I do. I think we would approach any consultation as a clean slate. We're listening. We don't know that we've come up with all of the best propositions. We were heavily guided by the heart and stroke work, obviously, but we're always learning about different approaches and new approaches, and we'll be very interested in hearing the full spectrum of what people have to say, what organizations have to say, and we would certainly, I would commit that we would bring back a full array of what we heard to this board, and that we would factor that into our thinking in terms of any recommendations that flow from that.
Thank you. Anybody else? Seeing no one else, thank you very much for joining us this evening, Mr. Jeffrey, and thanks for the presentation.
Thank you, Mr. Chair. I'll be sure to submit electronically a final version of my technical document. Thank you.
Appreciate that. Thank you. Our final speaker for this evening is Jillian Dawson. She's the chair of Ottawa Food Policy Council. Welcome, Ms. Dawson, and you have 5 minutes to present to the board.
Thank you for having me. Yes, I'm here on behalf of the Ottawa Food Policy Council, the committee in which I am chair. The Ottawa Food Policy Council has been to this table before, so you might remember us. We're an independent, nonpartisan body comprised of individuals representing all aspects of the food system, and we strive to enable broader and more coherent discussions and elaboration of policies related to food. Thank you for having us today. Let me first start with some general comments, the first of which I would like to congratulate Councillor Taylor for bringing this motion to the board and for your consideration of the recommendations. The Food Policy Council would like to be very clear in expressing its support for the recommendations presented, and I have some specific comments with regards to the consultation and the policy areas that you're considering. I think what the main point I would like to stress before you today is the fact that municipalities have a major role to play in defining the food environment and the food landscape. You control the zoning around schools, you control the advertising in city facilities, you control the procurement of food and beverages in those facilities. We talked about the Red Bull Crashed Ice event. I have the pleasure of using our great facilities on a regular basis at the swimming pools, and I see children going to swim practice and coming back and settling in for a pogo and fries and a slushie. I regularly use the Rink of Dreams, which is covered by advertising of a candy bar company. And, you know, these are areas where you have a large amount of influence. So there's actually, as been discussed by Mr. Jeffrey and some of the others, some options for federal action on this. And where I would see the Board of Health and where I would encourage the Board of Health to look is what you can do on a municipal level, because to a certain extent, depending on the policy option that's chosen from a federal perspective, that will have a great impact on the food environment, but there are also things that you can do on the local level that can't be accomplished federally. So I would encourage you in thinking, and as you develop this policy framework, to think about the opportunities where you can play on a municipal level and you can change the local food environment. When I think about the consultation plan that you have prepared, I would certainly echo the comments of Mr. Jeffrey in looking at the definitions, particularly around the terms restriction and how the definitions around foods and high fat, salt, and sugar. I think that there's unintended consequences in having and lack of definition at this point, because, you know, if you're talking about restricting, if you're consulting on restricting, that is something that's very difficult to enforce, as an example. So when you're talking about restricting, I think, you know, you're kind of predefining, as Mr. Jeffrey had stated, some of the areas in which you consult. So I would encourage you to perhaps maybe even have a pre-consultation in advance of your formal consultation to consider those aspects and others. And I would encourage you also to think about how you can consult within the City of Ottawa. I didn't see that as part of your engagement plan, but I think your sphere of influence in this policy framework is largely internal, or as much internal as it is external. I think about your city partner, or your partners, your other departments in the city who partner with you on public health issues such as recreation, cultural services, public works, tourism, and I would encourage you to make that a significant part of your consultations plan. I would encourage openness and transparency in those consultations as well, and that there are mechanisms to keep the public and interested stakeholders apprised of the consultations that are taking place and who will be consulted and for what issues.
You have 30 seconds.
Thank you. I think the other main point I would like to stress is that the restrictions, the idea to restrict beverages and foods high in fat, salt, and sugar, and the restrictions around, the general restrictions that are being considered here around unhealthy foods, really leave off the table the aspect of availability of healthy and whole foods, and that should also be part of the consultation and should be considered within this policy framework. So not just preventing accessibility of bad foods, but how local healthy foods can be part of this policy framework as well. Thank you.
Thank you very much, Ms. Dawson. Thank you again for coming in this evening. Any questions or comments for Ms. Dawson? Seeing none, thanks very much again. And
Thank you.
Thanks for presenting. So to the board members, now that we've heard from 10 delegations, I'm sure you have some questions for staff. I'll start the list with whoever needs some questions. Member Fleury. Go ahead, Member Fleury.
Thank you, Mr. Chair, and I'd like to begin by thanking staff for the report and thanking the delegations for coming out. I think, and presenting and being, and informing us as a board of the seriousness of the topic, also of the different opportunities in terms of approaches. I'd like to begin by saying that I guess today's report is really the beginning or the launch of the consultation, and certainly we'll need to the support of the groups in the audience to inform their respective membership, to inform our community. We'll certainly do our share, and I always applaud Ottawa Public Health's work in terms of communicating and outreach and consultation, so looking forward to that. This to me is a bit of a similar issue as what we're seeing with dispensaries on some fronts, with cigarettes, the history of cigarettes on another, and the topic that you might have read around smart cities and the use of technology. And the reason why I'm bringing the further point is because there's so many players, that it'd be the federal legislator, that it'd be the provincial legislator, and I think that there's certainly, although there's piecemeal approaches currently federally, doesn't look at the holistic piece. I think we have a responsibility here locally in terms of what we can do, but we can also play a bigger picture in influencing our federal partners and provincial partners in doing more. On their end, they have the same responsibility that we all share, with perhaps a different approach from education and healthcare at the province to broader responsibilities that may not be direct with the federal government, but certainly as a legislator, we can just look at the list of ingredients that are provided countrywide, and the lack of percentage points that have been provided in those that table for years and years. So I think we have a lot of homework in front of us. We need everyone to collaborate, and let's use a smart city approach to this. We have a responsibility to the resident. We're one combined effort and in educating and legislating and in restricting. So really no question to staff, but simply that it can't just be a standalone approach. It really needs to be, what can we do? Let's implement it locally, and let's continue the advocacy across all levels. And I think a lot of it has to do with the information and education parents have and teachers have, and the lack of. I mean, we go into school, and when we see what's being served in schools, or when we see what's being served at community gatherings, the typical barbecue, and I think it all triggers. It all triggers all of those, the similar type of issues we're seeing and what was presented today. So I've said enough, but certainly I view the issue as very seriously. I will participate in the consultation, and I want to thank my colleague, Deputy Mayor Councillor Taylor, for initiating that process and taking the issue seriously, and certainly would love to support public health and my colleague in any further review.
Thank you very much, Member Fleury. Member Kapoor.
Thank you, Chair. It was interesting and a bit nostalgic to see many of the same faces that I recall from the tobacco bylaw discussions back in 2001, and since then. Speaking to us in the public delegations. and we've heard a lot about the parallels between big tobacco and the marketing of food and drinks that aren't as healthy. And I think we need to remember that those parallels are valid because we see a lot of the same tactics. I talked about tobacco, about the 3 Ds. Deny the associations between these items and poor health. Distract by talking about other causes, and delay as much as possible any effective regulations. And I think if I can be as bold as to predict the future, we'll continue to see those same tactics because they worked so well for tobacco for so long. I'm not, of course, saying any of these industries are producing a product that has no benefit whatsoever, as with tobacco, but the tactics are very familiar. Given that the approach needs to be similar, which is comprehensive, there is no magic bullet, there is no one thing that a municipality can do, that a province can do, and that the feds can do. It needs to be comprehensive and multifaceted. It also needs to be looking out for, as has been mentioned by Councillor Taylor and Kakish, far-sighted enough to look at where the loopholes are and where people are going to try to work around the wording that's there, and as Mr. Shepherd said. So my question this leads up to 2 questions to the staff. One is, I'm looking to see how in the consultation plan there will be opportunity for participants to actually take us beyond what the 5 options are listed. We heard Mr. Shepherd and Mr. Jeffrey talk about energy drinks, and I want to make sure that there's opportunity for other ideas that may go beyond these 5 options. The second question is a little bit pedantic. When I hear options, I hear choose one of, or choose a subgroup of the options. But it seems that these are 5 separate initiatives, none of which are mutually exclusive or contradictory. So it's not clear to me that the word options means that we could be talking about all 5 plus. I assume that's, from reading the document, I assume that's what's intended. I'm just not sure it was there. So those 2 questions.
So thank you for the question, and sorry, and I apologize for not introducing. This is Sonia Jean-Philippe, who actually did a lot of the writing and the research, so she's here if there's any really detailed questions. But on the note of 2 separate questions, but I'll answer them in one package. What we've outlined is an online survey and the randomized telephone. Through those, we can put in an option of what other recommendations would you put. And I think where we're going to actually get a lot of that rich data of what you're asking for is through our focus groups and key information interviews. And I don't think that we're looking to go into this with kind of saying these are 5 and choose one. I think it's also a discussion. I think for this to be successful, it needs to be a discussion with key stakeholders about what would be feasible, what does this look like, and what does the health evidence indicate. So we don't at this point have an per se perspective that it would be, option 1 or option 2. Definitely trying to get that richness in the data. The options that we put forward are based on the recommendations put forward for heart and stroke, and I think we're very open for other alternatives that anyone would be bringing forward, and we'd be seeking to get that information through focus groups, key information interviews, and additional comments that could be put in through an online survey.
Just one small, a supplemental question. So in the survey, the online survey, are you going to have a place there for people to add in comments, not just beyond what the focus groups are going to do?
Yes, we can do that as well. Yep.
Thank you very much. On to Member Chernyshenko.
Thank you very much. I'm certainly in support of both the motivation for what we have in front of us. Thank you, Councillor Taylor, for taking this initiative. And what I hear from staff, we do, of course, always run the risk of scope creep, of this becoming a consultation about restricting advertising on anything deemed unhealthy to anyone by anyone, and that, of course, would not only not be what the intention is, but it would be doomed to fail as well. So that's the one concern I'd want us to keep in mind throughout this. It's already too easy to accuse any government that starts looking at regulations and restrictions as being an anti, and so we have to be careful not to start throwing everything into the basket of what might be covered here and what age groups we might be trying to protect. So I think that the public consultations, the initial focus groups and the broader consultations will help us do that, because I know that our citizens will guide us in what tolerance they have for the level of restrictions on, you could say, information flow. That's being very generous when it comes to advertising and marketing, to just call it information. Yeah, that's one that I raise. I just want to say, though, why I feel both strongly in favor of this and confident that it's the right thing to do is, as a parent, like many we've heard here, I'm looking for the government to be an ally. I'm not looking for the government to replace me, but I know full well that as a parent, you can model behavior, you can give messages for your children, but they are getting both role models, good and bad, outside of the home, and messages from all sorts of others. And to have government be an ally in helping me do a good, responsible job is really what I expect as a parent. And if we can do that through this work, then we're doing the right thing. Thank you.
Thank you very much, Member Chernyshenko. Member Kakish.
Thank you, Chair, and that was, I think, very well put by Member Chernyshenko, and it's information or alternative facts in some cases, too. I just had a couple of questions that came up as a result of the delegations, and I have to be honest, I came in a little bit skeptical about this, and because I'm from the School of Educate, not Regulate, but I think we've heard loud and clear from the delegations that education is not going to be enough in this instance. And I want to know on that point, what does public health do on the education front currently now, and how has that been working, if at all, in terms of what we have before us? Yes. Questions to you, I guess I'm looking at.
In terms of education, there's a lot of venues and ways that we do education. Largely what we do is work through intermediaries. So we seek to ensure that teachers have enough information, that they're talking to students. We're doing it through social media. We're doing it through child care centers. One of the big examples that I'll kind of get into more details is the child care centers. So we've gone in and went and worked with the chefs, the workers there, and kind of educated them. The next phase was in that we implemented guidelines to help them have more healthy foods in the venues. And now we're working with the higher level in terms of, okay, so what is the food cost? What does that look like? How are we doing this? So a lot of times when we're doing stuff, it's a phased approach in terms of, okay, we're going to give you the information, we're going to try to help you that way, and then we'll go into a policy piece. So we're at the same level with this piece. We've kind of been talking to a lot of people since that sugar shockers display we've had before 2011. We go out to a lot of venues and do that. That in itself is not, as you've heard, will not be making differences. So trying to educate a lot of people about the contents of their food. What does that look like? But as you heard from the delegates, it's complex. It's not that simple. And so looking to find other ways of doing that.
So that work, specifically that focus, has been with OPH since 2011?
Well, it's probably even longer than that if we're going to be like we used to. So the Healthy Eating Active Living, we used to have an Ottawa Active that used to do work. So this is probably, we've done a lot of the work for a long time. We have a group of dietitians. They're a small group, and they work through various partners to try to get the information out. Even another example is that we're working with the shelters of educating the chefs about how to get more healthy foods into their shelters. And so one of the things that you probably would see is that those are a population that would benefit from healthier foods, but we're not going to go tell people who have unstable housing how to eat healthier. We're going to work with the intermediaries.
And so what are our benchmarks for those programs? How do we see how successful they've been, if at all, in terms of tracking the progress with the work that you're doing with the partners in the community, with the schools, with the community health centers, et cetera?
So one of the things is the daycares. We're actually doing a fulsome evaluation of a number of levels within that. Were you able to implement were you able to understand the information that we shared with you? Were you able to implement the menus that we've created for you? What was the costs of that? That's an evaluation that we're doing right now. We'd be doing the same evaluations with the chefs. Were you able to acquire the information that you took? Were you able to use it? So it's through various evaluations of when we're implementing a program.
And would you say were the results successful, generally speaking, or were they, you went in, you showed them how to improve things and that was it, or do you see a lot of pickup on that?
So if I was going into the childcare, it's, it's not black and white. Like, I think a lot of times we go in and we try to work together. So when they're saying, wow, this isn't working, and we do the evaluation, and this isn't happening, and then we go to improve it. So yeah, there's challenges with it. There's some challenges. The municipal childcares they're broad and they're very different. Trying to implement one policy for however many childcares, they're different in each childcare. So we're going to work with each one of them and then trying to determine that. So some of them have been extremely successful. Some of them we've had challenges, and some of them we try to work through those challenges. I know you're asking for like solid data, and 80% of people have indicated this is great, and this people haven't. But I don't have that data at my fingertips. So we can be looking at it and share it with you. But generally, when we're looking to do some education with people on a focused approach, we do try to have that information, then also look through how do we work through the challenges.
And that is exactly what I'm looking for, right? Because if we are allocating these time and resources of staff, and I think it's great that we are doing these partnerships with the schools, with the community health centers, but that we have some tangible evidence in terms of what that is leading to in terms of, results or data on the actual obesity, and are the numbers going up, are they going down? And if we've been doing this for 6 years proactively, I think it's important to have some kind of information that would tell us what the education factor is. I don't know, Doctor, if you have any insights on that.
Thank you. You're getting, Councillor, at a very, very challenging question, which is the question of how do we measure impact of health promotion and health education initiatives in general anyway? So I think Gillian's nicely articulated some of what we do, but a lot of health promotion is, or health education nowadays, is not just through the intermediaries at different channels like schools, but social media has given us whole new vistas of opportunity. Of course, advertising in the past through promoting our messages through advertising or through social marketing is the concept where we're pushing forward and pushing out health education messaging through similar concepts to traditional advertising. The challenge comes in evaluation is two things. One is timeline, and the other is whether one uses process measures as proxies or whether one uses outcome measures. So while I was listening to Gillian, on the one hand, I was agreeing with every word. I think we have, certainly in the last 5 years, this board has put a lot of energy into some of the initiatives Gillian's outlined. But we could go back 125 years. I mean, 3-4 generations ago, public health was in the schools doing nutrition counseling and nutrition education. And if you look at the outcome measure and you link it to that intervention, which is scientifically probably not valid, but one would say that we did not succeed. Clearly, we're looking at an emergent health crisis over the last 2 decades in our community in terms of unhealthy consumption of nutrients, notwithstanding the fact that we've been in schools for decades, directly and indirectly. The challenge is then I get snookered because I don't want to pull the resources that we're putting into school health and school education away from that. We believe that we're having impact. And if we measure proxy measures, we can demonstrate that we're having impact. But if we measure outcome measures, there are these larger forces at play that we would contend undermine the health promotion efforts and overwhelm them. And so on the back of all of that opportunity for a soliloquy, I'm sorry, I would come back to, I think it was Mr. Munter, who made the point we can't educate our way and hope our way. I can't remember, he had 2 points, but educate our way out of this one. This one probably we've been trying to educate for long enough, but he made the point it's not sufficient, as opposed to it's not effective. I would contend that we have a lot of evidence to suggest that, at least from the point of view of raising awareness, our efforts are making a difference. But from the point of view of impacting on behaviors and choices, we will end up as a health sector needing the help of government by bringing in regulatory environments that help us help the public make the right choices from a health perspective.
Thank you for the clarification. And with regards to some of the delegation spoke about the legal challenges and issues, and I know we're very preliminary here, but why is it more challenging in this instance with these policies that they be appealed, or why are there legal precedents set against municipalities like New York? I know that was a unique one, and we're not proposing anything like that here, but why have the legal appeals been more successful when it comes to this kind of public policy?
So I might look to our legal counsel for a more informed opinion on that, but I guess my instinct is that I'm not sure that they have. I'm not sure that we're as far down the jurisprudence experience in this environment as we are in other environments. So one answer is I don't know whether that's even a correct assertion. A second answer is I don't know. And a third answer is, and I think Member Kapoor tagged it, one of the challenges we have in just conceptualizing educational messages, conceptualizing policy interventions that can be studied, is that most of these products have some benefit as well. So unlike tobacco, where there is no redeeming factor at all from a health lens perspective, we need nutrition. And so the debate shifts to the scientist or the clinician's definition of what healthy is. And the science is imprecise and difficult to do, and it takes time to do. And so critique of the science is that much easier. And I can only assume that the evidence that's brought, or that could be brought before a court in challenging something, would therefore be that much more subject to an impartial assessment that maybe we need more. So that would be the way I approach that concept.
And to legal staff, do you have any comment on what Mr. Bill Jeffrey was saying about how there would be some loopholes and potential for weaknesses in the legislation?
Not at this time. It'd be premature at this time to provide an opinion on that. But
okay.
Yeah, I wouldn't have any further comment at this time on that. Yeah.
Okay, thank you, Chair. And I think Councillor Chernyshenko made a good point about the public process and the consultation process, and that will give us a pulse and a sense of where people are at and how comfortable they are with the proposals, or in terms of the new rules and regulations that they'd be comfortable with us as a municipality imposing. And so I think that would be an important and interesting consultation to have. And I'm hearing from all the experts that are here today, and the many leaders that see this firsthand, and whether it's in the hospitals or community health centers. I think I've heard loud and clear the message of the importance of this work, and I'm looking forward to the public consultation and how that process unfolds in the next few months. Thank you, Chair.
Thank you very much, Member Kakish, and thank you for your comments. Moving on to Member Lakin.
Thank you, Mr. Chair. A comment and a question to staff. A comment, first of all. We've heard this evening from a number of delegations their support for the initiative to restrict marketing to this vulnerable population because it would impact on food choices amongst our children and youth and impact on improving health. And so from that, I want to just encourage us in the key messaging for this initiative that those messages pronounce the importance of this for the purposes of altering food choices and health rather than focusing predominantly on obesity, for fear of increasing the burden and the stigma with that particular group. I realize that's a large part of the literature that informs this initiative, but it's certainly not the only literature. And so if we could just ensure that our messaging doesn't overweight, pardon the pun, that population, overburden that part of the population.
Thank you. We'll take that for direction. And I think one of the things that one of the delegates also said that people who are overweight can be unhealthy and people who are lean can be unhealthy too. So that's a direction that we'll definitely take as we go forward.
The question I have pertains to something that I didn't read in the report. You gave reference to the fact other municipalities have used economic measures and financial incentives to impact marketing and in turn food choices. And I note that is not one of the options considered in the consultation process. A, was there a reason for that? And B, could we in fact consider those ideas as part of the consultation? And if I could just comment a bit whether that is considering financial incentives for preferred product placements, financial disincentives for unpreferred choices, a sugar tax, whatever. Could we consider inclusion of those incentives and measures as part of this consultation?
Thank you for that. I think we'll answer the second question first. So the second question was, can we include that? And yes, and I think that goes back to Dr. Kapoor's question, like, can we be looking at something broader? So definitely we'll be looking at that. From a financial incentive perspective about why it wasn't included, largely our recommendations were based on the heart and stroke recommendations that they put forward for the municipal government, and those I don't believe were one of the recommendations that they put forward. We've also had some discussions, and I know you're talking about something much broader than just taxes, and when we've had some discussions about what's the municipal jurisdiction or allowance within taxations, we don't have that capabilities, but I understand that you're talking about something much broader than that, and as a result, that is something that we can be taking into consideration as we go through this consultation.
If I could just underscore the importance of my question with a brief comment. Impacting food choices by way of marketing is clearly an important initiative. We're talking about influencing food choices for a vulnerable population, and if one was to walk into any corner store, gas station, it's at Arena Dépanneur, it's effectively a dispensing machine for some of the most unhealthy food on the planet. And there's no incentive or disincentive. And if we are to want to take this initiative to the next level, which I've heard references that there is an appetite for, and that there have been references to the similarity to this with smoking, then I would like to request that consideration of, or at least asking about financial incentives is part of what we consult about.
Thank you, Dr. We can take that as direction, and I think that feeds on what Councillor McKenney was talking about, but the financial impact as well as a result of these policies. So they feed into each other, and that's something that we can take as direction.
Is that it, Member Lakin? Thank you. Member Taylor. Whoop, sorry. Member Taylor.
Thanks very much, Mr. Chair, and thank you all for the discussion this evening. I mean, I think it's clear that, you know, even as we embarked on tonight's meeting, it's, you know, this discussion's kind of taking shape, and the consultation has, in effect, in many ways, just around this table, begun. So many good points tonight. I won't echo them all. Clear that there is a very healthy appetite for this work. I did want to thank. I didn't want to miss the opportunity to thank Dr. Levy and Jillian and her team for putting this initial work together and helping us embark on this path if the committee supports this, or if the board supports this. I was interested in Councillor Chernyshenko's point about you know, how parents want allies. You know, they don't want people to invade on their space, but they do need some assistance, and I think it actually doesn't conflict. I think it complements what Councillor Kakish was speaking about when he said, you know, I'm usually in favor of education rather than legislation. And I think, you know, when we talk about marketing to kids, and we certainly heard a little bit of just a précis tonight of some of the scope of that marketing, I mean, we're talking about leveling the playing field for people, not just parents, but people in general. Education is great, assuming that everybody is getting the information and that it's a level playing field when it comes to consuming it. So I think the education efforts have to continue, and certainly this is right within our wheelhouse. It's one of our strategic directions to inspire and support healthy eating and active living. I would make the argument as well, based on some of the points that Mr. Munter raised from CHEO. You know, another one of our strategic directions is around preventing infectious diseases. Well, you know, this might not be infectious, but we clearly heard from the Heart and Stroke, which generated kind of the interest in this topic, at least around this table, right on down from all of the other agencies, that this very well may be the largest preventable disease affecting our community today. And so, you know, with respect to some of the concerns about the legal challenges, I am not a lawyer, but I certainly, you know, look to some of the other examples that have been set before us with respect to, you know, the smoking. We've mentioned smoking many times this evening. I actually see a parallel to alcohol as well, and I know that the work that OPH is doing right now on the evolving conversation around alcohol, you know, we're dealing with another product there that is normalized in our community and socialized a lot around, not unlike a lot of these foods and a lot of the companies that provide these foods to our kids that we all came to know as kids. But I think there's a lot of comparison there and a lot of proof to show that, you know, legally, communities, governments have certainly said, absolutely, companies have a right to sell and market their product, but we do have a right to curtail to whom they're marketing and to what extent they're marketing it. We've done it with alcohol, we've done it with tobacco, we've done it with other forms of controlled substances, so I don't think this is any different in that respect. I do think that the public will guide us as we embark on this consultation. They'll tell us, you know, what they're interested in seeing us take on more of. They'll tell us when we're headed in the right direction. They'll tell us what extent, not only do they have an appetite for this, but they'll also tell us to the extent to which they're ready to support us in this work as well. So I want to thank Dr. Levy and his team for this, and thank you, colleagues, for indulging this initial foray into this, and hopeful for your support on this tonight. And thank you to all the delegations who came this evening. I know, especially for some who've traveled to get here or made special arrangements to get here, it's can be sometimes difficult to sit through a long board meeting. But this is the meaningful stuff that I think, as Mr. Munter said, you know, perhaps 30 years from now, we'll look back and imagine that there could have ever been a meeting about a topic like this that took up so many hours. Why would you even talk about something like this when it seems so obvious? But that's well into the future. Thanks very much.
Thank you, Member Taylor. Member McKinney.
Yes, I didn't really want to follow you. I know you wanted to wrap up, but I just wanted to clarify something. When I talked about financial implications, I wasn't so much worried about the financial implications of the report. What I was referring to was the sponsorship opportunities that we take advantage of as a city. And if it's, you know, if it's a caffeine drink, such as, you know, Red Bull, then I think that that's something that we have to consider and consider how we would forego that and not come into conflict with what I hope is, because I'm strongly supportive of the initiative here brought by my colleague, Councillor Taylor, that it's not in conflict with what we're looking at today. And just while I have the microphone, just a quick plug. Of course, we also have to remember, just, you know, on a parallel stream, building healthy, walkable, cyclable neighborhoods is as important for, you know, keeping our kids, keeping ourselves and our families, especially our children, teaching them active ways of moving about our neighborhoods, getting to school safely so that they don't have to be bused. So just want to make sure that we're, I know that's not part of this, but it does run in very strong parallel, and it's something that I'll be looking for in the near future. Thank you.
Thank you very much. Anybody else? So just to add my comments for this item coming forward. First of all, I want to thank Member Taylor for raising the issue 2 weeks ago with this board and also putting the motion forward. I also want to thank Dr. Levy and staff, including Jillian, in terms of this process, and thank you for all the hard work that you've done behind the scenes putting this report together, and which I think is an excellent report. In terms of the delegation that were here this evening, I want to thank them for not only coming to present to us, but presenting to us with some very good background information. And the final thing that I want to add to Jillian and her staff is the fact that let's make sure whatever consultation we do, it is a fulsome conversation and consultation, including all the partners that may want to join in. And if you feel, as the orienter of the report, that there is a partner missing or hasn't reached out to us, maybe it's time for us to reach out to them and see how we can communicate that message from them back to us. Because I think having consultation and having a fulsome consultation is very important and very key. I want to also recommend to staff, along with Dr. Levy, is all of the stuff that you've heard this evening from the board table as well as from the public delegation. Take what you need to take out of that and consider all of the recommendations that are here. But I understand also as a realist that not all the recommendations will go forward, but at least put the recommendations in that would help the community and the partners that are involved in this process. So thank you for that. And the final piece is somebody mentioned about financial aspects, and I think it was Member McKinney as well as Member Lakin raising the issue. And again, please consider that piece also going forward. And having said all of that, I want to thank the board members this evening for participating so actively in this file. And thank you for your interest in this file. So thanks very much, and having said all that, I'll read out the recommendations of the policy this evening. Recommendation 1, receive for information the list of policy options at the municipal level in the area of marketing to children and youth as outlined in document 1. Recommendation number 2, approve the consultation plan as outlined in the report. And number 3, approve that the chair of the Board of Health write a letter to Minister Philpott and Senator Greenrain in support of Bills S228 and C313. Can we carry the report with those recommendations? Carried. Thanks very much, everybody. Now, moving on to our last item. Which is the item that we walked on this evening onto this report. It's the update on opioid and the risk of unintentional overdoses in Ottawa. And I'll turn the floor over to staff, but before I do that, I don't know if Dr. Levy wants to add anything to the comments.
No, thank you, Chair. I'll leave it with Mr. Hendricks and Dr. Etches to take us through our rationale for bringing this forward to you tonight and what we're suggesting to you. Thanks.
All right, good evening, bonsoir. I'm here this evening with Dr. Vera Etches to update you on Ottawa Public Health's response to risk of opioid overdoses here in Ottawa. At the last board meeting, Kira and I had the luxury of giving you more information on naloxone distribution, including our pop kits. At that meeting, I committed to keeping you up to date on the latest developments in this area, and I know you've been receiving regular updates through memos since the February board meeting. This work continues to evolve rapidly, so I'm pleased that there was an opportunity to bring this report before you this evening, especially given short notice and what seems to be a full agenda. In terms of recent developments in the last weeks, there's really three key areas that have evolved that I want to bring to your attention, and I'll speak to these in more detail in the next few slides. Since mid-February, there has been a significant amount of community dialogue and interest in the area of opioids and overdoses. In order to meet the community need for more information, Ottawa Public Health has been in an enhanced response to actively work with partners to reach parents, schools, and young adults to increase awareness on the issue of opioids misuse and overdoses. Secondly, I want to highlight some of the ongoing operational work done by the Overdose Prevention and Response Task Force, which OPH chairs. This group has been working in a few areas, most notably around an interagency overdose cluster response plan, as well as advancing surveillance and communication plans to help ensure that organizations can respond appropriately to overdoses in our community, since we know that opioids, overdoses, mental health, and addictions cannot be addressed by one organization. Also, we continue to hear from the front lines that some clients hesitate to call 911 in the event of an overdose here in our own community. The Good Samaritan Drug Overdose Act continues to be discussed at the Senate level as we speak, and so there's an opportunity for this board to support that work. To respond to the recent community need, Ottawa Public Health teams and partners have been busy out in the community sharing information and resources with various audiences in order to enhance our reach. For example, this evening, public health staff are at St. Paul's High School to host a public information session for parents on opioids, and there's been a number of these events in the community. In order to meet the increased need for more information, we've trained an additional 80 staff, Ottawa Public Health staff, on opioids, naloxone, mental health, and addictions in order to better serve the community. Through some of the venues that you see on this slide, Ottawa Public Health has been able to reach approximately 10,000 residents, including over 4,000 students in schools. And if you consider the Stop Overdose Ottawa website, as well as the Parenting in Ottawa website, which has a new opioid section in it, as well as our social media platforms, we've reached almost 100,000 residents in Ottawa around opioids and overdoses. We'll continue to work with partners, including all four school boards, to reach as many residents as possible to ensure that community residents receive factual information in a timely fashion. The number of requests recently has stabilized, yet the team already has a series of school and community events booked for the rest of the spring and right into the summer months. In addition to some of these reach measures, we've also been working with local pharmacies to enhance access to naloxone kits. I can tell you that from July of last year, 2016, up until early March, pharmacies have distributed over 2,000 naloxone kits through 126 Ottawa pharmacies. And our own peer overdose prevention program, which is a program that is specific to people who inject drugs, we've distributed almost 600 kits now. I also want to highlight some of the work done by our Overdose Prevention and Response Task Force. I'll call them Task Force. They have a long title. So this task force was established in September 2015, following a series of overdoses linked to large music festivals here in Ottawa that summer. Currently, there's broad membership on this task force. It includes local hospitals, paramedics, police, fire, OC Transpo, regional coroner, local pharmacists. The Champlain Lynn is a new member. And we have several other organizations. In the last several months, the task force has shifted its focus to the misuse of opioids, given the international challenges that many cities are facing with respect to opioids and overdoses. As a result, the task force launched the Stop Overdose Ottawa campaign in November of 2016. Most recently, the task force has developed an interagency opioid cluster response plan. This will allow all relevant agencies to quickly respond to a cluster of overdoses. So other jurisdictions in Canada have seen large clusters of overdoses in a very short period of time. In July of last year, Surrey, British Columbia reported 36 suspected overdoses in 48 hours. So we're talking about large overdoses in a short period of time. And similar clusters have been seen elsewhere in Canada as well as in the United States, including Philadelphia, San Francisco, and Louisville. And most of these events, when they look back, are the result of illicit fentanyls or carfentanyls. Having a cluster response plan aligns with the requirement under the Ontario Public Health Standards for health units to work in consultation with partners to develop an emergency response plan. For example, we have an interagency response plan for influenza and for other infectious diseases. These emergency response plans include 4 phases: prevention, preparedness, response, and recovery. And a hard copy is here in front of you this evening. I think Diane has a couple of hard copies that she can circulate. It's 101 pages, so I didn't want to print 12 copies for you, but you can definitely take a look at it, and we're interested in feedback. In the prevention phase, partners will continue to increase awareness around the potential harms and measures to reduce risks associated to overdoses. And in the next few slides, I'll speak to what we're doing with, I already spoke to that, sorry. I already spoke to the work that we're doing around prevention with parents and schools. We're also continuing our work, as I mentioned, with local pharmacies to expand naloxone distribution. That all falls under the prevention phase. The 2 areas in the prevention phase that the task force has been spending its time on recently is surveillance and communications. In terms of surveillance, we have created a regular surveillance plan that allows the task force and organizations to respond in a timely and appropriate fashion. We acknowledge that there's some limitations in terms of the data availability and the specificity, and we're continuing to work with partners in these areas. The delay right now in making that data available to you and available to the public is that we're working with the actual owners of the data to ensure the quality of the data, the accuracy of the data, and to ensure that it's appropriate to be shared publicly while maintaining personal health information. Once it's approved by partners on the task force, it'll be shared with the board, other interested stakeholders, and the public through the Stop Overdose Ottawa campaign, which already has some overdose data. We also have a communications plan, which is a subgroup of the task force that has been working hard lately to coordinate public messaging relating to overdoses, and that has proved us very well in the last several weeks. Finally, in terms of emergency response, we are planning a tabletop exercise later this month with task force members to help test the cluster response before you this evening. Some of us from public health, from Ottawa Public Health, had the benefit of going to Kingston late February to actually attend a tabletop exercise that Kingston was hosting, and so we wanted to do the same thing here in Ottawa to see how we would be able to respond locally to a large cluster of overdoses. So the task force will continue to review this plan. It's kind of an evergreen plan, and so we would welcome your feedback on the plan now or in the future. In addition to all this work, Bill C-224, which is the Good Samaritan Drug Overdose Act, continues to advance as a private member's bill in the Senate. As most of you are aware, Dr. Levy presented to the Senate Standing Committee to highlight that the early actions taken by Good Samaritans can improve health outcomes in the event of an overdose by buying time for emergency responders to arrive on scene. We continue to believe that this bill is important because we know from our own experience in the last 4.5 years of running the peer overdose prevention program that only a third of our peers that have reported using naloxone actually end up calling 911. The bill was added to the Senate order paper on March 28th, so very recently, but as of this evening, it is yet to be adopted. It will remain on the Senate order paper until it's brought forward. We know that some senators have brought amendments to the bill in order to strengthen it. At this point, we don't have additional information in terms of timelines or the natures of the amendments, but we do feel there's an opportunity for this board, like other boards, to endorse this work. And so there's a recommendation with this report and before you this evening that the chair of the Board of Health and that the medical officer of health send a joint letter to the federal government to support this bill. In closing, if you accept this report this evening, the next steps will be to continue our work with partners to expand our reach in terms of public information, as well as making naloxone available to those at risk of opioid overdoses. We will ensure that the task force continues its work to prevent, prepare, and monitor overdoses in our community, as well as making overdose data available to the public, and support Bill C-224 as it goes through the legislative process. Thank you for your time this evening. That concludes the presentation.
Thank you very much, Mr. Hendricks, for the report, and thank you, Dr. Etches, for joining in. Before we go to questions of staff, we do have one public delegation. If the board agrees, that I'd like to invite the delegation up to speak. Mr. Sean O'Leary, he's a parent representing, I guess, himself and the parents discussing this issue. First of all, I want to acknowledge Mr. O'Leary for the work that he's done in the West End with this issue, and I welcome you to the board this evening. You have 5 minutes to speak to the board and for the presentation. Thank you.
Thank you, Mr. Chairman. A couple of things I just wanted to bring up and questions for the board or concerns from us parents, mostly in Canada, but also in Nepean and some in the East End and mostly from the suburbs, as I think you guys have been doing a good job at going after some of the things, and I thank you for the Good Samaritan Act. I have a meeting coming up with Dr. Philpott, and it was one of the things I'll be bringing up with her too, because the people not reporting overdoses is a big problem. But one of the things that I'm here to ask the board, and whether the answer can be tonight or at the next board meeting, is I know the Ottawa Board of Health is running the task force in coordinating with the police and the paramedic service involved in getting the stats for overdoses that are happening in the areas in town that they have been happening. And some stats were given to me from early this year, and then based on the first 61 days of the year 2017, if you extrapolate the overdoses in the city of Ottawa, we'll have an increase this year of 50% over last year's numbers, I think, which you guys reported at 101. And I would, based on not on, I guess, real evidence, but I think most people would agree the overdoses, and you would have the answers better than me, increase as the summer months start coming on, and especially the younger people can start heading outside. So as a parent and as now the executive director of We the Parents, the one thing we ask the board, if they can, and this has been forwarded to you in an email previously, is to get us the stats on a weekly basis. They're doing it in British Columbia. They're doing it in Alberta. And I would think that in Ottawa it would be nice if we started ahead of the game instead of waiting till the problem gets to the epidemic time and then you're giving us the numbers. At least having the numbers up front and on a weekly basis will allow us to see any of those clusters happening. We'll get to see if kids in our area, Canada, are starting to overdose on a more regular basis. Lately, since we've had our meetings, it seems to be a decrease in Canada, at least from what I can see, but we don't know this till we see the numbers, and the numbers supplied to me show that Canada right now has 28% of the overdoses that are reported by the paramedics in the city of Ottawa. So from the parents and that, we'd like to get that data, preferably on a weekly basis. It's being available in BC. We read it every week. 174 overdoses, 12 deaths. All we're asking for is to let us know the numbers here. We know they're smaller, and that's a good thing, but the sooner us as parents of be their children or be their younger people, that we know that this data, we can help protect our children more and keep a better eye out for them. So that, I don't know if you can answer the question today, and I guess from our organization, if we could maybe put that on the agenda for your June 9th meeting to address that. I know you have the task force going already. The second thing, and Dr. Levy and I have talked about one at your other meeting, was education. Our group is very concerned that Ottawa Health and Supply has education programs for grades 7 and 8, but at this time, still not all of our schools in our city are giving those courses. And I guess the question to the board is it the individual schools that make that decision? And if so, can we, as the parents, be given the information of which schools have agreed to educate our kids, so at least we can then approach the schools that are not being given that education? Because I know my daughter is in All Saints in grade 8, and this was brought up at the meeting in mid to late February, has not received any training, and other than since all of this, they had one thing in the auditorium. That was it, and that was all. They have no courses in their health course. They are taught nothing about it, and as far as I'm aware from everyone at Ottawa Health, is that the education plans are there. They're not necessarily what I'd say is 100%, but for the time being, they are what's available. And our biggest concern is the fact that some schools are supplying that education to our kids and some aren't. And if the Ottawa Board of Health could tell us or give us a list of, here's the schools where they're getting education in grades 7 and 8, and here's a list of the schools that aren't, at least then as us as parents can either educate our kids on our own or start putting force on those schools that are choosing not to educate our children to start educating them.
Mr. O'Leary, you have 1 minute left.
All right.
Please.
So that would be the second thing. And the third thing, and again, it would be more of an answer, I think, for June 5th. I've heard some numbers from the mayor's office on a few things, but the Ontario government made an announcement a few weeks ago about $2.5 million being given to the City of Ottawa to help fight the opioid epidemic we're having. And I guess my question is where, or what is the plan for the money, and how is it going to be spent to save our kids and to give our kids some recovery options? Because at this time, I know some of the money is being allocated to training firemen on naloxone, which is good, but there's a lot of money there, and there's a lot of young people and a lot of older people struggling with opioid addiction. And I think there's some good money supplied by Ontario, and we would like to see what the plan is and where that money is going to be spent going forward. Thank you.
Thank you very much, Mr. O'Leary, for your presentation. And I'm going to turn the floor to Dr. Levy for some of the answers, if there is any, in terms of some of the questions. Normally, from public delegation, we don't take questions.
Okay.
So what we will do is we'll discuss the question, and if, unless Dr. Levy has some responses,
and as I said too,
and we'll come back.
If it's June, more of it's to June, because I know there's the task force going on, and I don't expect that all the answers are here, but I guess I asked to speak so that the Board of Health can know that as parents we're organized, we've had meetings, we've discussed this, questions were given to me to be brought up tonight, and I understand that all the answers aren't there, but the three big things that we're looking at are the reporting of stats is available in lots of communities throughout our country, and has been a great deal of help in some, and to get started, the education, which we are aware of, and trying to work on that, and then how is our money going to be spent to try to address this issue. So thank you again.
Thank you again. And Dr. Levy?
Thank you very much. Would just start by again thanking you, Mr. O'Leary, for being here, for sitting through this meeting, and for actually having brought so much attention to this very troubling issue. The really short version, I'll let Dr. Etches and Mr. Hendricks comment, and perhaps Ms. Connolly as well, but the really short version is we're aligned with you on all of these pieces. The statistics Mr. Hendricks mentioned, where we're at on the stats, one of the biggest challenges that we have with early release or any release of the data is that however carefully we put out the specific definitions and the specific caveats and limitations of any particular single data source, there is a real challenge that the data gets interpreted and develops legs in a way that tells a story that's a little different from what we understand from the data. So specifically, just to pick up on the example that you did use, the paramedic data from the first 7 weeks of this year, neither we nor the paramedics can say with confidence that that is either accurate or complete with respect to what it represents in terms of anyone thinking that that is the picture of opioid overdoses in our community. So we have to really, really be careful and responsible about how we understand the data and communicate it with our public. And that is why jurisdictions throughout North America have struggled with this issue of timeliness of information and timeliness of data. I can tell you that all of the agencies are putting together all of the available information and putting significant effort into ensuring that it's available, that it's ready, that it's available to the public, just as it is to us. We use it. We don't always use it before we're completely convinced that it represents full and complete accuracy. Sometimes, depending on what the information represents, we take action on our own clinical interpretation or interpretations of what it means. And so it's a constant battle or a constant challenge. But I assure you that we're working on it, and Andrew has mentioned that. With respect to the education piece, I don't want to be that government official that tells you it's a different department, but we can certainly facilitate conversations with the school boards. But we do facilitate conversations with the school board. The particular issue, the grade 7 and 8 program that I mentioned at the staff evening, at the parent evening when you were there, Mr. O'Leary, that is not actually an overdose prevention educational intervention. That is an intervention that we use in some schools or offer in some schools to parents of what we call transitioning youth. And it's really a parenting skills program. It's quite generic. It isn't specifically the opioid piece. So I think my interpretation is that you're particularly keen on ensuring that every child in school in Ottawa is exposed to information about opioids and about drug addiction early. And we share that ambition. We've already heard on a different subject this evening the limitations of education, and certainly we know that we have a limited reach and impact in terms of what we can achieve with different schools. But I commit to you that we'll explore that with you in terms of how we can facilitate your group being in its discussions with school boards. And on the third point, the money. So right now, the efforts that are going to this issue from all of the partner agencies at the municipality are being done within existing budgets. Certainly, we're in ongoing and active discussions with our municipal partners and eventually, I'm sure, with community partners. And so when those plans materialize and firm up, we'll certainly be sharing that, as I'm sure will others, with all of the partners in the community. So that's really how I'd respond to you. I wouldn't presuppose that this will be an agenda item in June. As you can tell, a lot of work gets done at this board on a lot of issues. But I can guarantee you that this is an active issue for us at the operational level, and we'll certainly continue to engage with community partners, including your group.
Thank you.
If I may, Chair, look to Vera and Andrew and Gillian if I've missed anything. Thank you.
Thank you very much for your presentation, Mr. O'Leary. And turning the recommendation back to the board, any questions, comments for staff? Member Tilley?
Just first of all, a comment to Andrew and the team at OPH. I work at one of the downtown shelters, and for the congratulations on the quick response when immediately I had some concerns and questions, able to meet and have an education information sharing process, learn more about the drug, how deadly it is, in particular how little of it can kill. So that's my comment. Thank you to Ottawa Public Health and for engaging with partners like ourselves, the Shepherds of Good Hope, the Salvation Army, etc., and Ottawa Inner City Health. My question then is, in the event of, we hate to think of the epidemic, the cluster, and that amongst our population as well too, but in the event of such an outbreak starting, could you maybe inform us of some of the assurances we can have and others, perhaps police officers, our frontline staff who would have to interact and engage in situations with clients, perhaps teachers at a school, as far as the preventative care for things like wipes, masks, other equipment, gloves, and that to prevent contamination, because obviously in that event, anyone who's engaged in having to deal with a scene would have fear of contamination given the deadly effects. Perhaps you could educate us on some of your steps that you'll be taking to give those people who have to engage with that situation assurances or preventative assurances that they won't come under the deadly effects.
Thank you for your comments. And yes, so that has been a topic of discussion more recently, especially with illicit fentanyls and the carfentanyls that we're hearing about from other provinces. We're actively working with kind of all agencies around kind of personal protective equipment that's required to respond in these types of events. So working with police, paramedics, these are all members of the task force, and that has been a topic of discussion. They all have different occupational health services that are available to them that they can access, that they can get recommendations from. And the Ministry of Labor has also been very active on the file in terms of providing recommendations to frontline responders. What we can say in terms of responding in the community is that we recommend personal protective equipment. And so police will often be first on the scene, and they will clear an area. They will make sure that an area is clear before it can be accessed by anybody else in the community. And so they've been providing recommendations as well as working with our regional coroner. So we have various point people and experts in the field that we rely on for that information, and it has been central and part of the discussions.
Is that it, Member Tilley? Anyone else? Member Kapoor.
Thank you, Chair. It wasn't clear to me. I saw some resources for health practitioners and for primarily physicians. It's not clear to me what other communications back and forth are going to be from there in terms of signaling the need for escalation. I'm thinking of CHCs, emergency departments, the inner city clinic, and in terms of getting what kind of information other than these educational messages is going to be broadcast to healthcare practitioners. And I'm assuming that most of what we have on the task force are agencies. I'm not sure which agency or who's there with on behalf of providers, so just to make sure that communication goes well.
Yep, so in terms of communication specifically, we have different communication tactics that we would employ in different phases of the emergency response. And so what we matched was, so there was some work done around Ebola, when Ebola was a very interesting topic, right? And we matched the work that was done with a subgroup, a communication subgroup that was done specifically around Ebola to one, prepare messaging in advance of a crisis of taking place, or for the case of Ebola, what's going to happen when there's an Ebola, if ever there's going to be an Ebola case here in Ottawa. And so we've kind of matched that subgroup, and so we have a task force, the overdose task force, but we also have a subgroup where it's the communications folks from all the different organizations that actually get together to prepare messaging in the prevention phase and in the response phase and those types of things. So they've been preparing messaging that could be used in the event that we have a large cluster of overdoses. So who would be the spokespeople? What would be the key messages? How would we make sure that each organization kind of, we call it stay in their lane, so that they're talking about if there's clinical, folks needing to speak about their clinical work, they can, talk about that work, and public health and so on and so forth. So that's in terms of communications, the back and forth that the subgroup has been doing. In terms of the different members of the task force, I think it's in the briefing note in terms of the list of, I think we attended, it's probably a supporting document. Is that right, Diane, that we have a supporting document with the full list of the members from the Overdose Prevention and Response Task Force? Yes, the Coalition of Community Health and Resource Centers are a member of the task force. Vera, you want to add something? Yep.
Sure, if I may, through you, Mr. Chair. The LIN is also on the task force, so I think of their primary care lead and their interest in communicating out to physicians. I think your question was a bit more specific about communicating with healthcare providers. So I'm thinking of a couple of other points that may be relevant in addition to what Andrew was saying. The messages that healthcare providers have received so far is a bit about preventative, what the situation is, and resources more generally, so how to support parents where treatment services are available. The information that would trigger another communication may be an increased risk in the community, so that would be based on our surveillance system where we're looking at information on a daily basis. If there was something that caused us to need to issue an alert, we would do that directly through our emergency response messaging system. The longer-term surveillance project that is shortly going to yield a public product that speaks to the trends in overdose information will be something that we can put up on our new, digital communication strategy, our new website, our new interface with physicians, which is in development, but that would be regular information about the context, the community situation. That answers your question.
Thank you very much. Anybody else? If not, can we look at the report recommendation? The report recommendation number 1 is to receive for information the updates outlined in this report with respect to Ottawa public health action related to opioids and the risk of unintentional overdose in Ottawa. And number 2, approve that the chair of the Board of Health and the medical officer of health sent a joint letter to federal government in support of Bill C-224 and the Good Samaritan Drug Overdose Act. Are those recommendations carried? Carried. And the report carried? Carried. Thank you. Thanks very much. And thanks again to staff for putting this report out together.
And Chair, if I may, thank you again for accepting the walk-on. I know you don't like to do that, and I respect that.
Thank you very much, Isra. And moving on to the rest of the report for this evening. Information previously distributed, which was the action plan towards smoke-free Ottawa. Can we receive that report? Thank you. And motion to adopt reports. Member Pennell.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, Ottawa Public Health 2016 Annual Report, healthy eating, active living, protecting vulnerable populations to restrictions in marketing of foods and beverages report, quality improvement plan for 2017 to 20 report, Ottawa Public Health Emergency Preparedness and Response Report, and delegation of authority contracts awarded for the period of July 1st to December 31st, 2016 report, and update on opioids and the risk of unintentional overdoses in Ottawa report be received and adopted. Merci.
Is that carried? Thank you. And moving on to motions of which notice has been given previously, we have none. Motions requiring suspension of the rules of procedure. Anybody have one? None. Notice of motion for consideration at subsequent meeting. I don't see one. Confirmation bylaw. Madame Pinel, please.
Chair. Be it resolved that confirmation bylaw number 2017-2, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of April 3rd, 2017, be read and passed. Merci.
Is that carried? Carried. Thanks very much, and we'll call the meeting to an adjournment. And thanks everybody again for this evening's contribution and for attending along with the public delegations. Thank you, everybody.